Yebo atekira kaisa kanyuni chunya kuongon Voice of Teso angeskwa na idaujo alomun toma ido ikura isokunyuni jo tomo program kuonlo ka TesoGang tomo studios nete dakan kanyape ngeskwa ni jasi osan ikanyuni lu aparan kakro Charles Sakeru ido dautipe joko alomun le jasi tomo studios jasi munwe jasi toma online dautua ichaka toma ichie ido ichedo netine tomatogo anoimoro keronia crossit nalolo jaro ni aireiki ni adoke tight keda kronu kamanara keda ngaleu aneo Teso ido ajai ngisit ilo loto mapakna ebe nyo iboro luiteo ni ebe rasilu ikoto ni aite kwa pelu epolok luda epedorete ahengaraki ni tunga anikamanara kedeja utenelo angaleu Saraija ijo toma online arija itoma Zoom jaitoma Facebook page kosi lwejas toma YouTube lwejas toma Signal la kaisa kanyuni chunya kwa Voice of Teso kura ishalamu kini ya sida kere nare feedback usbuna takurokina domun otoma pakna ngari lainin noti uni kanyangoni yare kanyuni wongone noti kanyuni kedi wongon preja warikai kitikesa wai are not kanyare not kanyare not diopet ikanyuni kedi wongon not yare keda idiopet ipere bobojo ebikakin na takonu omisho toma WhatsApp kosi onot kanyare kedi kany ikanyuni wongone not ikanyuni iuni keda yare railo basabiti na joku nari marta paresha tomna kanyangon ano ella pa aloi kanyetangon Carlo ilukum ni yare keda kaisare indopet ido ijon ilo lokede asabiti arasabato na gogongo no narai okope jokolu nyara utano hapa kina lolo erasi piro itino be ludelo se inerkeroni kaimoro nikamnara kedeja utenelo angaleu. Well, I would want to bring everyone on board, those who have just joined us. We want to appreciate the fact that you are going to be part of this show till 5 o'clock. Our time right now is only 8 minutes after 14 hours, and that is 2 o'clock. My name is Charles, and tonight we shall have a very special discussion here talking about the health crisis in Teso, and we are looking at what should be done or what should be the key priority areas for intervention. My name is Charles Sakeru, and in this program, we have been honored to have Professor Umaswa Francis. Professor Umaswa Francis is one of the elders, a professional doctor to that effect of Teso here, health professionals. And we shall be having Dr. Etol Wilson, who is a physician at Soroti Regional Referral Hospital. We shall also be having Dr. Olaro Charles, who is already online to be part of this discussion, who is the Director, Health Services, Ministry of Health. When we talk about the government of Uganda, Nora Waraga, she's already in the building here. She is... Nora Waraga here is the cultural anthropologist, managing director, SEPA Uganda, a non-profit development organization. She's already here in the building to have this discussion move on. And then we shall be having Mr. Stephen Opeitum, who is the AIDO Uganda Vice Chairman, Board of Directors. And then finally, we shall be having Honorable Claude Bosco, MP Wusuku County, who is also a chairperson or chairman, Teso Parliamentary Group. And I would want to make my word round to say to my guests, first of all, to say hi to the listener, and then we shall be able to move on with our program. Let me begin in the house first with Miss Nora. Good afternoon. You're most welcome to this show.
Good afternoon. Thank you very much for giving me this opportunity to share on a very important subject of the health of our people or of ourselves in Teso. Ayala mangonoi, Voice of Teso. Aina kinongarere nguna. I'm more kiron wi kamuntos okaijara. Akiron wi kamuntos eja otene lo angaleo. Ayala mangonoi.
Well, Yalamanoi, and then I can take it direct to Professor Francis Omaswa, who is already also online to have this discussion. I want to welcome him on board to say hi to our people who are tuned to Voice of Teso, your choice radio.
Yoga take care, yoga knowing. The Voice of Teso, Alama, Itamaki, the Voice of Teso, program, Itamaki, the Voice of Teso, program, Itamaki, the Voice of Teso, program, Itamaki. So, that would be done upon the Itamuno Kinajakata Kero. Daretema akapak na alimun wala salimun do amunor esikere paran nailai.
Yalamanoi Professor Dr. Omaswa no alomontomo program. I believe everyone who has been following you do know that we are talking to the icons of Teso sub-region, people we are proud of. Let me switch to Dr. Olaro Charles from Ministry of Health. Good afternoon, Yoga Lomuntomo program, and we need to have you on board. Thank you.
Good afternoon, Yalaman, Voice of Teso. I know I work in a program law, and I shanakina atekero kera I'm more na kiron bukwa ne jas npetioko akop kere nuka COVID-19. Yalama.
So ateker Yalama noi narai idawa dumnu noko ipejo kane. Let me have Mr. Opeitum. I can see him on board and to say hi to the listener because we need to get into the gist of the matter as we move on with this program till 5 o'clock. Yes, sir, you're most welcome to this program.
Stephen Opeitum. Alama auto program lololo. Po ibune neri kwapa igadi moderator.
Thank you. And akodo kwa nanga limoki na tekero kwa panginabe boikindojo toma radio because icheda lwero kedolna tomo studios na ibuna na domnu kesi anoemo rakronu idauto ne ipikakin lolo ano a discussion work ibalo ni bonebe kopokwa na ireiko ne eja utenelo angaleu. We have things that we can look into the health crisis in Teso, what should be the priority areas for intervention. And of course, we should also need to understand that when you look at the way we are doing things, you'll find that the coronavirus invasion is also amidst us. And we have also other health problems that we need to look into and see how to help our people. So, Arija idojo kwa pangina, ijaona enermi kamtosi eja utenengon lo angaleu, ido ilosido ni aimoro, achuti, aitete, otomangaje po kona Teso, usodikini amuchaltane jaito mo studios ne kara epeda limokino na chieke da Teso keda busugun iloso ni adomuno keda odocho and akudonga geunu keda professor akudonga geunu keda professor reason being railo etwan le rai seasoned ido swama akroni kamtosa ngaleu ageuno Teso. We can talk about globally eja utenelo angaleu otoma kwapsine kiere ido itutenge jok ebuade kana corona arangese diope otomotunga lwa pugano Uganda kerkino to consult anyunebe BIA pedorere ang eitemokin eja utenelo itunga keda riebo na corona akotoberengo ageunu keda angesi tetedokwa na ibongno na irekinebe ministry la ngalewe balabai dobo luche stakeholders etemarate kesbia nui kamnara kede eja utenelo angalewe doko ento na irekinebe dobo dokwa noni aneo Teso inyo kana bo iboro likotone ereikisi ebe kotorasilwe polo konoi ano aina kine angalewe na itunga ara utune pedori ejana kin tetere takana unakiria nut nara chamutebe nejari angalewe akirian today apie otomotunga kuna ageun kede Professor Omaswa Yalama.
atekeri ogabugo. So lo nyaron toni Voice of Teso kwa pelimo tutori kesi ebe surokit Teso adekana corona dobodo kwa kisai balasali monoretano wapugan ebe Teso district naluo Teso keseras luingaren tosko Uganda kere toma alimonor itunga dusrono kina alibona eko akisai atekere asodit ade kana corona na bu rade ne subiti wala mame nyuni ane akwap meri Uganda bon konya kwa kere mame nyuni na tipet ejasibo ade kasine ngono viruses tielwo leopote lapio oliorite onye donna esuit bali bunia sala kadoni adauna pak ne woje ikav umomo ijena corona virus le pajan lo virus angol ale yaw ne tutu flu rai genas ido pedori corona da ai kwa kinni osolu wachie kwa pera le virus lo tete mambero ni jeni mameto anene jeni ebelo sai kwa kinni nari akwapke temarati chiebe kwa kine basi chiebe kwa kine kwenye jula kini bobo mamkone so irawa ni kere luisisia lu America lu China pakai irawa tunga luisisia krono virus alo isisia kwenye na pepolo ngesi nipengeni ebe kwaira riboreni buni ajai tin kaoni a down pakina ngoni jeni akapana kinos etemo kisi irot seone amora boy kele virus yo na sodit nini tonganan kere anijai ojenube akrono aiga garite ariobona akon yesijas konyemera akona puga ijoy lopet otupaki ni kwenye tumamul lu boyoto jo luorekon lu atubete kus area esi nyesi ipolokit asom na nyinbe isukunya tone lulo elwana aneja tutubeta huko aneja sirere huko aneja sitonga huko noangun ekotoni ai choretangun no ina kona puga ido na yarit ano asipedo aritesa chamun ai choretano apugan ekot ojaye ngadeni kino na chai na eupas keda akrongon nwebala pugana na so ko arera no bebilbi akrongon ite tunga mamituna pedo retai tup tabarete dobe rikote lwa kolokoni jecha wachwa toma koloje to sabiti la tubo reboite ngadaote nge sabiti rotes sabiti ya nyuna kanya pe September tolibala atomnado kwa ngene ajayenga kanini abwenga any ebe atwa kesia je takanore je unaro nusinetwani etwani otoma etukuna sitwangen kwa pe kolosek sitebale mame corona ido no abwenga any otoma tesado pet arai political leaders kesberebe ngare ntosida ano abilibil standard operating procedures wa puga kesegeo neta juki cholonga ngena cholonga mutan opodo konyeta itodia na rangi na yango mutan okweka tunga lipitenges ayo wasaijara na itonga oko atama togarona itidisiara tukono kintunga aro manyito ara tonare Orai o nilu ngare nok. Kesi bale tunga be sore alomaka ngasna ore amutan. Konye ijasi kisila lo apugan. Atamataberone atupata mudu. Aipo inyamat otomarunus. Epotunga atukunen mora sani na ekona ikopa de kopone. Na vere na sodis na anye ngesingini. Ijenyo ni choreta no apugan konye mami tupiti. Ido wabi konnen lu ingari ni kinto soto mabili bila choreta no apugan. Kesi wabongu pengu luera se ngari no luti ito dikitose tunga erot lerior. Aso popokona etemokapugan epone lo iboyo tituma bena kech kwanat local council 1. Ngun local council 1 limokin adukune committee lenye tata village COVID task force. Ido edukakenda moli LC1 ikapun do yenye pon le korea apugan kapun pama quarters, quarter 1, quarter 2, quarter 3. Yeta quarter lolo so moli LC1 isirigin lukumina for 100,000 lukumina quarter. Osodi kujua mud ay doko kin kujua mud isirigin joka keta ni village health team member. Those community health workers ngulu nyata village health teams. Joka keta anula pe anguli yare isirigin lukumina kwata uni isatemar ngolap isirigin ilukumina kwatat anu village health team member. Aso anyu tu ebe adolotika punlu nejazi committees health task forces keda nejazi village health team members. Ete radio unete asomuta. Na asodit. Ai bono kin. Na reka punu lukumina kwat. Beti LC1 chair. I tosom ano ibo ikinositunga ano wapola inu wadi kind of minutes. Do ba kipi mema tunatitumi bote. Alright, asi chie wore ene konos kesi pula kinosa no I connect lote ki komo. Do ponite ki komo tata makero. Koto makero anae ngabe deka. Ngaibanyo alosta kinga abongu ebongu te ngale ebubi pejono no rea ngaiba pejono ngale to anine na bune osodo konyet community health workers mul VHTs village health team members ya urkeda tabo lo pejono kinoto kesereria oreo maswane jaso masokela blood pressure arabeja askele sukali ngara kisinyesi dia ejaitwa ne kama dekane rebera dekana na corona merenge yuka etwa ne mteterelo sa some test area nyunu babo me test ngole right positive awoma metwa ne dekano pero kesi ria unda ni the health assistant lo jaso temwan ai rimorere ngol de ejaineta kanunyore alo ne pedoro etwa ne na ngadara wa ne yata isolation teterimu pewa mina omam itunga luchelu dinyata ngesi ore isuro kinade kanye nenyata home based care asongonu kere rasinu abeit memerasinu hesab ikapulumule jas aramedo lutos ne jase so chalo ingitate kao nare kao mesijuka kita ikapulumu esi luirazi MPs esi luirasi political leaders isi what ingitutu ojentube alu likapunumul ido ikotse kotone kaya nyube adolo kapunumul nyinane kotore ido itosomao ano asomo amin anaijukuntere ari tuponi mun ipedoroni anyube pedorade kana ikunyar obuo kanijani Omambo ni rai ngul lu iteo ebe kesi moikacheta chepa kete marobe goloi Boloro ilu Teso, mama bas ne losen ne tekna, mama luang ne chamo ina bunere Kampala, mama nikot ne no otakan. Aso ya kaita kero, no vera kotore na geona kesi mun. No e uriaka, ejade kana, bamenyu na tipet, esisha utaupa kelade kana, ido epundo uperon kelade kana, echai, etmwela maikenyes.
Yalamanoe Professor Umaswa ano aya on beroni up to speed kede inerikata ngon inakino ni asipo kina na riba na ipole enyanyara raribona kede nwe tamtapu gana swam kwape consultant lo abuapu gani tojoka bonebe ekotora epiro ititile perora ngaraki tunga lo Uganda ka kwapkere ano ITG ariba sineno achamutengo benato ngarnangina ibuno na ireikin the integration of other health problems into this narai kopokwa na iteje pole enyamiata ribarie basine ida itunga achiengun achepa keperitwe na aomo mosoda temarbe depidobe pole dedengari e corona da. So at later time we shall be able to integrate that in this discussion. Otherwise, let me go to the Ministry of Health and have some 5-6 minutes there. Dr. Olaro anwaina kinoni noda meeting esi noda soma eri ngetelo angaleu osorikindo oni ya reikini kedalu cheda itunga nweba kaskesi. Yes, Dr. Olaro.
Okay, yalam chama kini nga jaus keda yaslolo aparana engiston kwa nabe ajasi aslight side sakutunga konei aito diari aito dikin kwa nabe epone bani ejari do no ipukera lo sengenere no itakane no Teso mereno akwa pukere. So imagine repera chama kini
It's okay. Mamache.
Iboro buo takanu panabe. Ageonu osabi so akaisara no kanyape ola polo kaintape to na kaisare ola okara ala kaisara no dopete to na kaisauni ola polo kaintauni apota atwakiasi itunga akwatatika nyoni otomo tunga akwataka isauni no perkitai adexoroti and net todo kunabe a case fatality what we call kunabe otunga alo edekasi lo poto otwakata arai akaisare, which means kunabe akaisare otumito otuma kwata lo perkitai opoto otwakata. And yet genuine kunabe akwa pukere. If you look at the case fatality rate, erai itungi uni otoma kwatat, which means that potona atwakes tunga lipu noi. So eto dutunen kwanabe bala agiari kwana esta the wave abunera akwa. Konye olapa akanyi sabitla la akanyi olapa lo ikantangon obuyebolo ikiar dropping from akaisa uni to na akaisa ran wongon in July and then olapolo kainta uni ara itomo kanyari konye kopoko na asu ineroni ado uko poko na ni ekes fatality rate ngon itongi kanyape katu to bet, which means like itongi kanyare akwatat liperikina awore iperikino adekis etwakete, which is still a number likonai ikiaranwe just as accepted. Yeah,
it's okay. Mamache pupsojo nyikokjo, though your network is not all that fine kwenye chamtengo be bongokini.
So I was showing Kanabe, Abalang Kanabe, Ajasla is not on a Amorun. I don't know whether the host can allow me to share.
All is well.
It is still disabled.
It's okay. Ipereja lusa kwenye kede ekoni ner do kwenye te ibune kwenye anyano na chidongun kede network.
Okay, achamo. So just I told you kwanabe iwanyija akwa kere. That's the term as the whole world. Imilioni akwa taraka sara nukany. Kese zule confirming ai. Ana at itwakia ni milioni ni wongon akwata kanyape. Akwata kanyapa na kanyape. Itunga lopota atwaka kwa napa. Kwenye wanjo in terms of vaccination, wanyo njo kwanabe ita billion sikanye kona tai adom to vaccination. So nen ikore alimoki ni tungalo Teso kwanabe ibala onane moni kota vaccination kwenye wanja akop neni chieke akop keri billion ikany akwata kany nesule kota adom tunyo vaccination. Kwenye Africa kere this figure kwa ngera ibala only 20 million. Or Uganda, those who have received a dose do parelo yare erai just kopukwa na apakina na ikanya rai million tedo peti kila kwa takanyapi. And yet kopukwa na ejasinyo vaccines nikotona ikonai aingara kino. Ite districts even was kote minister ainyaku vaccines muna ayangara nchie. So specifically kutonga loste so that Uganda kerebe twakiani Uganda itunga iloko miniuni kera kwa tata kitomna kanyare konyi imaraja ne ostoroti ola pia ngi twakiane akra kanyauni. So specifically kwanabe ostoroti kwanabe it districts le pola de kanoi rai 10 kapa iteoja ni kwanabe rai 10 ngora keda soroti iwanyi jo like 10 and soroti almost nini parani kere mame ya parane mamerinyo ekesilo me lo itetet. And a majority of this itetet ane kere rai alert are du muntu kwanabe baraka be are wolai mwana kwan ame ikone jok olo sai wanya ke abore ale mare ke sample dumunte bongne sample kwanabe rainyo rai positive. Anakirano ipu noi nebala adao professor ineri ijoba ya mutationu so otesto erai kwanabe itunga itutotunga kwanabe mambore ijola kena ilosetunga lo ipu noi etpanito nan ana no adomo kwanabe nen ekorare virus lo lonyo lo epolo noi. So iwanjo kwanabe kaba bara kwanabe ianga mapu ngina porse pera bwana kini kwana kisim kwanabe ay butoriyo kesimun ani tete nene rengenin tolikinyo kwanabe 10 mora soroti support radinyo import rad cases noi kwenye district speed the cases are there as compared to the rest of the world of the country. And the majority of the people who are affected. So iwanja nen kwanave alo yanganaro alo poto otwakata ito mana kanya pe etwakitosu jasine pa adolu na bore for treatment unit otwakete akaisarano uni opoto otwakata down aparasia na solid kana na uniet nen todo kwanave mame tunga I following aite akiro no home based care very well anwadu mukwanave engera dek kota akeritinyo dekis so itunga lukerelo poto kata parati ikanyauni mama ilo iboita deksa down is a bit of it which means ba dekas tunga lu noi ane nui po ara itunga le polo ikara kaisa kan kuju kedabo nui po so mamadu mutosunyo vaccination so angera kibera ko kwa nave itodu ne kwa nave itunga lepo mamedu mutosunyo ekato omi du mutoso vaccination anet ko kwa na akwa epuatanyo ejasi vaccines akoto rengano engeta kina asanganyi kwa nave ara je district da longora lebeta anya kunu vaccines because expiring and omsikoto vaccines expire kai or districts so iwanjo bolo adumsa lopoto downos ajasi kedade kasine achie ade kane pressure ne sukali agangan no apote eta uni poto na konai atwaki asi I think apai kini berongo anen ko pana den kontara jeche abuna to bonge kau
Yalamanoi Dr. Charles Olaro ano aina kino ni berenwe jasi to murionge telo angaleu ngesnani balarbone be ikota jenbe otoma pugan kede rionge telo angaleu anibonwe jasi narai dumukwa najo bonbe focus ngon erai anuari woko na oteso so dikini figures da ichie todungesi anuika mtosi akwapuoko Uganda. Let me have Madam that Miss Nora Waraga here. Now, you've seen what is happening. Itejo no ejasi kopokwana anuika mtosi eja utenelo angaleu. What is your insight?
Yoga take care. Alipitonge sachama kinonge nera Teso keda musugunda.
Ebo.
Nare ejasi ngun nu akoto ngoti apupu nukada atemasika kwa penate a prime minister na banja mamne seje na Teso akoto doka nonga inyala musugun keda Teso tetere ngunde iche epupu nete nuka
okay
apupu ngakironu anere Papa Oko, Professor Omaswa. And I would like to sort of bring in other listeners. Professor Omaswa gave a very good synopsis of the warning. Coronavirus is here with us. It will stay with us. The chances that it's going away are not there. It is a visitor that has found us here, and we must learn to live with it. That is the message, strong message from Professor Omaswa. And he has pointed out that Teso is an epicenter, and because of our behavior, Professor Omaswa's point was very heavy on behavior of Teso not following the standard operating procedures. And he gave an example of our political leaders actually being among the greatest violators of the SOPs. Akodo moda lo mariane panin ate maribe e focus no ne ebakarebe yoni tunga eponene ingirtoro na itupu aichoreta aba na pakisa masks ilotata kanin kwangin social distancing. Akodo ngalo maranin, should we only focus on the failure of people to follow the SOPs, or should you also focus on those responsibilities of the government that should have been put in place already to manage COVID? We did research on tuberculosis some time back with my organization, CIPA Uganda. We found that one of the major things which is similar between TB and coronavirus is that you must stop the spread. And in order to stop the spread, you must quickly identify who has been infected in order to isolate that person so that they don't infect others. inero na beiti ani oteso achuma nanu epedrete asunyakin te masara testing kits awanya na ritunga ajenu be u adumu chalse e covid kale masingona wa itete mamune siko pakiniche e covid eja na arai akwapsine nguna che other developed countries e utasi kesi IT bone covid, they are stopping COVID through stopping the infection rate. And to stop the infection rate, e utasi kesa IT soma awanyanar edumoni Charles be jaije COVID no makinete jobe olotbere jawai ongalewe kon COVID eringaji bonguno tunga. Akirongun nese poloko. Achumana no ewanyanarete ade kasine ikati angunwe e COVID, kati angunwe TB, airborne diseases. Do we have the diagnostic technologies? That is our biggest problem. We need to look in that direction. Onyowanin olot eda onawanyunu badumitweni e COVID. Where are the treatment centers? Dokwana neoteso Bale treatment centers, Eraya referral, Soroti regional referral is where you can go to get treated. When someone is brought to Soroti referral for treatment, are all the necessary treatment gadgets there or medicines there? We had so many distressing stories of the patient may have survived if there was oxygen. But the patient did not survive because there was no oxygen. So not only do we have an insufficiency of diagnostic equipment, we have a challenge with treatment. Iyanga ijanu joba dekakini kontwen. Oyangaji kontwen adekisida mamei aingarakino nepol narai achepa kiboro nwepereta aingarakin tweningin e mamete otomadekis. So angino palisa eraija yangu ni tweni toni Soroti. Ambulance ne yangu ni tweni ene deke COVID toni Soroti itungano ipoma mepedoritos. Itungano nyama kineti tweni ene deke COVID eja ikesa napiti gwen ngunu ne ebaka ibe isimekete COVID aikonai alomuna ne olotobongina. Atesi nada nguni wanyu ni jobe mami gwene ngun the special protection gear for the personnel, health workers, but also special protection gear for the carers of one who has suffered with COVID is insufficient. We must talk about those as well, because it is not sustainable for us to think that we will stop COVID in its tracks while we are only following the put on a mask, wash your hands, social distance. It is not possible for us to focus on that. We need to focus on quickly isolating. COVID, you isolate them, you put them aside like all countries are doing. And then the biggest other protection that other countries are using is vaccination. They roll out a vaccination campaign so that at least erasitunga vaccinated. Adumututunga e kato. Ber igeoni jaiti bwoni ebe katunga. Awanyutubi tibwononi aikopanar na adek. Kwenye bobo ibalajo ayatakisi aswamune kato. Koje baka mambo boko na pedora angari someroi. Nara imamu somesana keredu muntosinyo e kato. Iboye chiduore kwa nadauta iboyore adauna paki na akoni etiabai. Nara imame inyo e kato. Mama ngawa mitibi puitu nganwe ngirito se kato. Kwenye ibore ene polo emame ekia ne kato. Ebunekia ekeretitu ngadumu ne kato aibuo jo adauna para nikere. Kwenye baka eberigeoni soke ditunganu nyo nwa ipolo kobere ara mami tichazi idauni jo obongori jore mamidu muntinyo ekato. So ekoto ne neri borongunda kere amori kikitos merai tevi palio kiteso engerosita sa na pa maski ipalio kiteso engerosita sa lotaka nini orai bobo apugan nyobibi kakitose ese awanyu nibeja sa chuman nwe wanya narete ajenu nube edumuti tweni mutane COVID edumitwane etweni mutane COVID ejaine pedorobera yangarnes ojai berenesi tonine konai engale una nesi tetete mamnesi kopakini bobi chetunga adek aneni bobo ekato ekiane ekato opono yangu na iteso ne do liteso kere konyebe yangu ti piso idio so tatemari igeuni bere aina kine kato imesemesana. So we must be honest and talk about the other side of how the nation state is managing the COVID pandemic. We cannot only focus on follow the SOPs, which we have told you to do, and moreover, most important point, the SOPs are accompanied by a very restrictive regime. I die to ngai belai. People are the enforcement of SOPs comes with chibok. It doesn't really go down very well when you see young people. I understand now they are recruiting more at a Masara LDUs kwamen. Adumuni esapa chuti sapa nupudidi kedaete polon mamina peta maske. Idumune sapata no apoloni uta remonori. Amine sapata no didia uta remonori etwena apolone. Kotokode enforcement da obu ojai some kind of ayong itenu apoloko. Limo joke. Meme plan no ibunajo aremonora mojongo be nyoma mji naptore kon mask aramam araibonat I noma mojongo belabe nyoma mji naptore mask. So the way that the enforcement of the SOPs is being done causes a lot of distress within the community, and therefore that enforcement of using violence, of using force, needs to be checked so that we begin to see this as a community initiative where we are moving together. So I think that that would be my sort of first opening point, that it is important that we focus on the overall handling of COVID in terms of, do we have diagnostic machines? Do we have testing kits to prevent the spread of COVID from one person to another? But also at the same time, can we protect people through vaccination? How many vaccination doses did Teso receive? Is it commensurate with our population in Teso? So if you send us very few vaccinations and then you say, oh, Teso are not hurrying up to take the vaccine, but if we go and line up the whole day today, we don't get the vaccine, and then again tomorrow you are expecting us to come back and get the vaccine. So I was thinking that I'm suggesting that we must look at this holistically. And lipitongo be neroni wakitunga be ipalioko anerata bere edole COVID no, edole corona no, tomana Uganda edumunti bo oni ijaye ponani epejonon edole pejonon itemokina je pejonon edole pejonon joda egogonga kwan inyamiti joda ejok pero joda ikonai itg pejonon ngon be orwa elo me pejonon ngon toma odumunte joda achumani pero itg nikini jobe wu adoluje pero joda sunyake na temaribe aloto bera adumekia konyo epu epejono ni ngoni jeni jobe itweni mutani ngina chepaki edumunta dekangin pero jodai wonyarbe aloto bera ngoda adume kato tete mamongoda adumuna dekangin. So how prepared were we as a nation state to receive this deadly virus, to be able to fight back this deadly virus in terms of the health status of our people, the bodily health, in terms of if this virus finds you when you are already healthy, your body can fight it back. But if this virus finds you when your body is not healthy, you are definitely going to go. But most importantly, our healthcare system in terms of diagnosing, stopping the spread, and also vaccinating and preventing you from getting the disease.
Yalamanoi Miss Nora Owaraga Ido Chamtongo Bay Losoni Chude Joko Kedoko program Narai Yado Kwanoni Kede Atio Kiso Nweja Sikede Ariebona Kede ni Womiti Beti Ipedo Aswam Akutoberenga Yaunu Eja Kaiti Andrew Opeitum Narai Kota Dumtunuke Asote Kwentoni Aire Unokin Bobo Icheboro Otomo program Anepane Narai Krona home based Nunana Bala Professor Umaswa. I would want to ask Dr. Olaro whether how effective it is. Nare kwa naitejo inamba ilu eutasi alosa konyelu itodunti bonibe atiche paktikwa na ijasi akrono aina kisidi kote ni nare ara idi baloni be SOP sejastunga toma krona idai tunga kedi tunga namba le polonoi. But then you'll also realize bonebe things like what Madam was trying to put across here about operations unete stigmas no mambo between perotra losit anga ratipaketwen la doma riebona automadek sotomapaki na yesu pana, and then also to confirm some of the things like Professor was saying there's this money, rebate alosito mochaloi. How effective is that exercise? Nare idumu jobonebe isiriginilo adolereto mautunga. We have always got these experiences. We have just got some COVID money experience of Nebanja and so on. People did not benefit. And how effective is this approach? I would want Dr. Olaro to have a hint on that. But for now, Andrew, because we need his opinion on this. Yes, Andrew. Okay, fine. Let's first pay some bills here, then I'll bring Andrew on board.
This is Voice of Teso, 88.4, the people's choice.
Ekatwan, iyo gabert. Iyo, itirorti sirigin lolo. Eke kilo ekon motoka. Echo longolo taxi. Itirorti ekon simu. Akibot. Araba mausa swam kun. Araibo yoga ikina kede paperi twasama akani kun. Konye, iye mutolo ajiokak. Ngisluta. Twasama sabuni na ka skin guard. Asanitizer. Kede skin guard hand wash. Take, ongole abreja konikan. Iyo, itirorti ibo isho. Nwepedoreta dare kurutule corona. Adaoni sawa na luipo. Nara jam. Singese jia saidio boistikere. Mamo nipedora itikokin. Aso twasama sabuni na ka skin guard. Asanitizer. Kede skin guard hand wash. Ilosi akonikan. Ngaren, kau. Kiding na ikon bokor. Keda beleke kanen kere. Skin guard. Ngesi inakini jo. Ayuara na idolite.
Get the MTN Kabode smartphone and pay Pola no stress. Dial *165 *5 *2 # to know if you qualify. Then rush to your MTN service center today and get the Kabode smartphone. Pay for it Pola at only 5,000 Uganda shillings per week for 6 months using MTN Momo. Terms and conditions apply. Everywhere you go, MTN. Be aware of conmen. Only accept calls from MTN on 0312 120 000. MTN is regulated by the Uganda Communications Commission. Reachable on 0800 222777. Toll free.
Hey Richard, thank you for the meal, but can I have more chapati and some to take home? I have not tasted anything like that before.
Sorry, they are finished. Everyone ate only chapati and posho today.
Sure? I noticed that even the posho tasted great. Where did you buy it from?
Eh? Have you not heard about the new wheat and maize flour? Supreme flour comes with
Eka Kiror John Julius Ichoto ajana pape JJ somadi kide porlo Teso ido ipupu ya night lockdown ipupu jengo akaili pane jase sukiere ijeno nibe adekana coronavirus mamelosi konyitunga kestolo sete etojo kasino balerio ngetolo ngaleu aiboyore alana kina anapata mask ido.
We really want to first apologize for that hindrance because of network issues. But we have now Stephen Opeitum on board, and we need to have his insights. Nwika Mtosini Otona Emoro Tomapa Kinalola Nere Professor Maswa Kroni Langrinoi. Dr. Olaro has given us statistics. Policy potori figures kedisula Nwika Mnana kede corona globally, nationwide, and Teso kwa pejara oko discussion. Ms. Nora Waraga here has also given us very key and important points. And we need to have your insight on this, and then we shall be able to ask ourselves some questions that we would be probably be able to have answers to help our people. Yeah, thank you.
Mr. Moderator. Professor Omaswa. Ebe adekana nyine tuane kota itinta kwa na kebe rakani nikone jenyo adeka ijara kone jara kani nikone konye aiteka kopa jare ngochalo several times. It is going to go beyond that. Eje mindset let you know not only ninja Teso itunga kere eje ibo ne bakebe ikota ija neni la nyone decent barrier Mamera politicians but no. Mamera lo chalo but no. Onda lupisho mitilu polu. Kesi you can rekapuno chaloi. And I connect for burial ceremonies. But we go there even ourselves. So there is a need for a mindset change. A decent burial does not involve exposing itonalo ipuenyo atonare. Eja eso pisulus matapugan betona itumu. Konyeba kabe mam etona eja ikini wakotana nela nyone decent burial. Amika multi politicians bono ni kere. A mindset mune kota julakin. E punimali julakinere. And a previous speaker Amuchala Tawaraga. Bejaino, I tosoma a bit of us. I did discuss the chairman LC5 category one type, but no. Iboro Lakirono burial. It is no longer a family affair. Kote district dollar motoma. I don't see chat upon a ponology to enforce that. Mr. Iborenetuno, but we are not going to run away from that. Nareje attachment in the explain decent burial. Ili monokini to ngebe mam, kopani mame oni wada bakebe nyo, a burial. And like so kotunga do mwache tumtare, a memorial service, nare kopani situation le joni. Mamere loko le joni setibe, batu woti mongine yare, kwa kisime. Eje bakelo mune bakebe eso. Yes. They break, but at the same time, my own observation of Chalwang. Indeed, the Munja Mudon cannot toss masks. When you do Munja mask, and out la Pioni, la Pia Canya, the mammy lost time. I would blame you for that. In your only close relatives, Kwana, Mamoni Cotuano Poom. You'll be the one being attacked, but nobody in your Mikajo is Shadai Costumanan. That is where I'm actually accepting the idea of the Okotenyo enforcement of the Jaitama. We took Pakina and leaders. In your machinery, Ali Monti professor the Jaikon machinery law, Gombo Lola, healthy teams. That thing is more or less like a ritual. And you're not that to address the mourners. She will come and he come and tell us. What in around Bitunga Kota Choitos and up to masks. You're quite kissing it. Can you do money already to just much more than what they should be there, and more than what they should be there. So you do money just check be Johnny there, that machinery there, the structure, like healthy teams up to a challenge. But they are more or less like doing a ritual. They do not have the capacity to stop people from gathering. So we need to go much more than that.
Okay, but we can still stretch a little, John Narai, as Aido. We have always been also having some information that there are some interventions that the organization like Aido can do to help the people in terms of boosting the health system of this country, particularly when we talk about Teso.
This project started as a result of our observation. Nejaro Chalongina. Abuandru Opeitumana Cheko from America. Keda Kebero Abiola. They point to the polling health system. How do we intervene? Idumuni jo kwa petition kata kuyane. Itungalo ipo ekerete matani. Idumuni ja berobeje amajong jade kepur. Ebaka ekoto 800,000. Agwele mom. Agwela eten. Agwela kine. Toni bodo uwe rigwela naroni boromu. Anwa amukian. We had an informal chat but I guess no, it's your Pan American. I happen to work with a company called Project Cure. not really working, but they used to help them as part of their corporate governance. It is one of the largest aggregators of medical equipment in the world. They're operating in over 130 countries. And so far, they have donated equipment about 2,000 containers. How do we take advantage of that? An implementing agency. What a sponsor coin. I told him, yes, we have IDO. That is how it started. Now, we interacted with the Soroti Referral Hospital. I must say that team was really up to date with what is going on in there. We asked them, what is it that you require? They had a list of equipment that a referral hospital should have and what they have now and the gap. So we shared that with the project. They said, yes, we are able to do an intervention. And that is why we have now reached. We are trying to get the medical equipment. The value is about $350,000 that we expect to come into the country. But we also have to make sure that we interact with the relevant authorities. We had one of our guys connect with the Minister of Health because there's no way you can do that without the involvement of government. And at a later stage, we will need to have that equipment inspected, what they call pre-inspection, before it comes into the country, to make sure that what we are getting is really what the country needs. So that is the role Project Cure and IDO are trying to do. We want to see what can we do to help Soroti Referral Hospital. They did their requirements. The information we got from them, government did an intervention, I think about 1 billion shillings. The requirement is about 5 billion. So what is it that other actors can contribute to make Soroti Referral Hospital truly referral hospital? And that is where we are coming in. And we feel if we succeed with that and make that intervention, we can also use the same system for equipping the district hospital so that Teso is truly a proud region.
Yanamanwe Stephen Opeitum and why nakinone picture on like come to say the interventions of stakeholders are able tunga lo tamto sanyebe ekwa kisai ano oko tunga. Let's take it to Professor Umaswa. Kirono eneri ni kamtosi siriginilu alomu ntoma otunga itunga luda ejasi kede COVID itunga lu aiboitomo chaloi the way they are enforcing kotoberenga inakinjida kana iuni kwangen anoiti jenikini ateker. Now we need to have comparisons on how other people are doing their things. Nara ikopokwa na iwandojo idumudojo bonebe ejasi iche borolu itete tungabe. Look at countries Rwanda, Kenya, kedachebo ison we come to see Asiomanda berengin alopet. Bebia idokwa na ipedo rotorakironguna. How do we move with this wave? Because at first you say it is here to stay, but we have seen things like open schools, lock, close, go home, go back to school. Now, if the thing is coming to stay, how do we stay with it? Oja sioman, oja siso konin, because also, economically we are not doing well. Oja si akrosin repedota inakini tunga kirianutu. Aja utuberetoma oponelo pejo kwa jokot. Abuna nga nyakunu jo, akaulona onado mnono.
It's 3 p.m. Agentness wakalo ngisinu mtijo MTN. Itosoma pointa na konuka MTN senchu. Osodijo adumu na minatu luka titai. MBs luka titai. Arai imessages luka titai. Echika star idopetu wongon dopet hash. Oseku use points. Osodi atupaki unitubitai. Teteri dumuni aina kinedekon naka senchu.
Everywhere you go, MTN.
Machi kwa na loskeda oko sawa lo yarit yoraido lo yarita washa dabo toma program wakane. So I was taking it to Professor Umaswa. In this, that you've said that the disease has come to stay. Now, how do we stay with this disease when we have issues to do with education, in progress, markets or trade to be free? We have issues to do with our daily life, the social being of the citizens of this country. If the disease is coming to stay, eponebani ebeitoroni to navigate aijara woko. Keda riebona, osyometidwe, arojasi semeroi, ojasa dekisha, ojagwelanari, nare kopokwa na kiriantu damamu era ina ilo sejoko. Yes, Professor.
Kopina na gem torem na solid ngesnata de kot tunga achamun bijade kana da achamun ebe anoi tikokina de kana ai kop erai oni kulepek intwan rakekwan akwana na itunga aware itunga luareke kechedwe watutu bete kech kwa nyemera itebe apugan nyese una soma kirongo apugan ya kironi soma apugan kwa nya kirono anyige yoara jorekon yoara ja ne boyojo ilosi ya kani inyami ye jok iberi ye jok ido mikiti yo ade kana irima orekon ako kon ijasa kiron dodo kana eloguna pugan be just wait type there in the governance system. So kopokwana just ngono about village COVID task forces. Village LC1 egion tutorakirono. A chairman la village COVID task force ngesbo we chairman da LC1. Do to mo committee just village health teams, just cultural leaders, just religious leaders, just tela parish chief, just people departments such as representatives kechang na doketano kwa na pugan community development, do our production extension workers, just a committee mode. Esomero areje somero chalomodi yes somero that more committee. So now elosa pukori someron ipupnete sikopokone elosa liver pukori someron again November is very gere tertiary schools institutions obun bodo konyete primary schools sweetwale tiyokarebe pukoros January dode pukoros someron erai annually be itosoma structures mupemul village COVID task force olosi parish day committee or term day committee sub county oloso district mul kese anunetete be isoma ite systems mul kere arai elo setidwe anyonu norerea alo station obomor nati wore bom ejai village health team member lo chala ngoni anyuni be orari abalu ejasi do siomete losene nto somero ido ere ya ngulu ejasi kele je tunga kwana te alu ejasi kele ate kasini achie are bolu emo jongitos tete bere ngule gere ai kama kine katwa gomu natema no kato seki olosetu bodo ebe jitu anene koto kwana limu ntore home based care is to retire those village health team members upon the somatang au pas keda adexiano ya piete health centers we piete kili chalo yangu osodi are eloma atwanare ochala yangu LC1 chairman yesmori kunoskali kule pekere ngoli awoloka tekeri religious leaders lu enyarauna ilipa tesini anyu nebe sibo ikini tunge jok to protect SOPs. Obuni bodo college ejo mo ikachet. Golita ekopokwana places of worship. Golita markets. Monu kere epota pukori area anyunibe apukori beri someron. Mamaro atunes ne polelo mutotoma. ide chamuto stoma tupita kiro no nane enera Madam Waraga yes mame joko na dai tunga that should never happen mambore no read your twane kere rai chor lo emorera kiro bikatunga okupo experience akiro ni coordinator konyemere abafana tunga mame nini also this dalu chorio mame deading so le pendulum neri dedingare wa edopet do idea ondo be any ebe connect to kisil yes do elala polo na kia dedem ade parene beta to kisil also de no atamarbe mameta pugani nyo mameta pugani etameta pugani diagnostic equipment ngulu wa covid just health centers lo Teso ido ade kisna soroti Dr. Tolo na tenerane kukora kituma no ikwala na limne boy kino ko yete no kila kes bala na yare no no sabiti yete no kes somaiti ijas keda iboro lu tamto tora ngara kituma mambara iboro kere konye jas dupe jas Teso kesumpo le jas ibore kabale kesumpo le jas atupwe na chiekere so ara mamo ni chasi obuok oni kesi ibuna de kana aiboikin toma mamo ni te nenichie era oni kolepek ngesi akoto lenga ituria na balebe ibuna de kana jaut adauna pakni woji e kato wachamstunga era ibabete dite kato mamera Uganda bone kate katera kwa kukere kwenye ponla pupiemo wale rosete doses milioni tomona kanye uni alomu kupokwana kwenye ekoto vera geo kena ngud alu epakna de kana yanga kolok sodgo watu pakinete mundu baka isiana kinak alimol bedwel de someroda ara chate de lekia kwenye kadite kato akwa kere well, apart kere kala Africa kala Asia so yese kaliti do eraibo munda chenu itatama na para na chie aso akodengo angetaken abongo kino chekona balebe ani kisade kana atamatavero na itu SOPs atamatavero na itu ibo aga ngani ne joka puka in fact I know ni sirigin ngol LC1 VHT akwatata ngolap eraibo rene polo no automatica punule jok etogo moti committee ngul ido agogo ni committee ngul lo muni anapeje wani ido mga koto ai pupu no ba karba pugana ngai ba pugana o ni ngesa pugana areji bole ne kadete ni koto na pugana ile koto gogo mona nenyum tor ebe koto siboren konyemera ai darit askukitakani ba pugano buya kwa kini darite sa pugano government etu yambe skunya siboren na wata konye structures ijas institutions ijas etuma lesoma ijas ibore deni boni mami kwa na panu asesani ano palunto na kirono ade kana Yes, neni etukono tunatetu etunga mema sto na masks o goro ingai ojo man korse goro pastor of course atwanti ne piping in twani kere ko nyibora ne people a kere nyesa e kopadek otoma atesi atamadon na titingoto other regions are doing better than we. Even Teso da ne pani Jaiko jataro nusnaje inapene no model sorotini. Rekeja Captain Mukola. Tupita iwole joko no ane. Nye abuga nga anyaro nusachie. Neka muntenga ane no mukura. Mama tupita keomu. Anubu inyo. So mama nga jeni ara icha itaka kilo. konye na possibility pengine be mo kinosberani e chaita kirone beto na itu atupata kiromo na iji bore ne kadit mo kinoskela engarno kok ama utubore nyin and ni stop pay tum kala kon tamti ya ai lipito no kingangin e poni ngol nyese to ron halo stay ngari yalama.
But then, Professor Umaswa, maybe kede etikatikate dopebon on vaccines, because we seem to be in a situation of uncertainty, and people are trying to have alternatives here and there in terms of vaccines. We have also myth and misconceptions about the vaccines, and probably to hear from a professional like you, how effective are these vaccines? Because you find this time around they are saying AstraZeneca, you don't mix with Johnson Johnson, you do this, and you know, people are not certain. And even there is that kind of stigma from people banning people to get these vaccines. Is there any statement that you could really give us to ensure that we don't get any fear to have the vaccine?
The vaccines kwa engo adenga do mune vaccination ka tumaloreka data do mune vaccination ka ara jenga bono kin ti mamenye la kwana osodi vaccines kare tomaite mamoni seibe ronolo so na uniet ejitunga due peletos a pellet asamana kin vaccines akiro Narai, Mariette, Kessi, Kera vaccines, Ikapun, era American, Essia Seponeto, Sierra Dakera Torna, Nina, video le Palane, and a professor Lalomutane, and then I'm in a cron, the Rocco, lost a Skerato Acare. So, Mampu Petacron, Putacero, Minera Pugan. Kiron Minera Pugan, Igili try. Vaccines lo ya unapugan iyepon lo itemuno tintere through WHO and so on. So raibo nukon mun apologeta jao pakale gor kekoko ebuiko kumini sapata bolo pa polon balikara kaisare kreichie ainger no vaccines nara edini kenelo senenge saili limota nginabe roko vaccines or kolojete covid sapata Ichie heads of state yare dupane edu nyatao mamai covid ara koje covid tungamuliare asovesi arisurok je covid obala be mam vaccines somaite mamera pugane 20 ijo ngesi 20 ari pajana koni ngesi 20 kwenye joka vaccines upaya auta imulukere otamata adom na remu na dominate siare patu bukus mama jeni ara abo motin akoni ni set
yala manoi amate bakebuna ara unu napokade rainu pupi nera situnga kwa panginanu ekuro situnga jeno anwe kamna kede vaccines. Before I bring Miss Nora here on board, let's firstly hear from the Ministry of Health. Aneja Jakaita Dr. Olaro. You were trying to give us statistics, and these statistics, we don't know. Eponeli tukioto resi, lidumu nata resi sulai, luikamnara kede vaccine silunare. Idumu jabi sulai lu eshumi otomo Ministry of Health. Sometimes mamu itunga ikomparing ete kedalu isomasi okwapane. And then too, the good thing Dr. Tolo has also come in here. There's also the other aspect of the coverage. Where do we get these cases from? Because when you say Teso is at the epicenter, but then at the same time, people have been brought from Kitgum, people have been brought from northern, from Karamoja, from these ends of the border. Maybe doctor will also tell us here, really, the coverage of the patients that they always receive. But then let's first hear from Ministry of Health. These statistics, how do you get them? And then two, you talked about these vaccines getting expired. You would also tell us, what is the problem? Why is it that you are now recalling these vaccines because they are getting expired. Is it that people are not getting into administering the vaccines into their bodies?
Since now Dr. Tolu is there, we will tell you whether we are importing all those people from Kitugum, wherever you have mentioned. But as I mentioned, Agaret na Panave, Kopokwana, Itungala Dumutu, vaccines, Aquapukere, Erai billions, Adeparilu, Ikan. So if Itunga Ngunukera, billions, Ikan, million Aquatakanya, Kesa Unanu, Adumun vaccines. Ano ni lo Uganda and Pachala or Teso ringa on Balapana vaccines kotai iso maiti. In the UK, I think already they are at the Pasupi Loa Mundo eligible population, they are over 70% who have been vaccinated. So Iwanjo Kopukwana Atomana Kanyoni Olapalo also roti ajasade kakakesa Kanyauni Anuka. When you want your Mbale, I just only Ikan in the COVID center. Mbarara Ikanyang onobon. Liga Akaisare. Hoima Yare. So, Iperon Altadikin Jopanabe, I bejatunus. Bejaon atunus ai. Bejatunus ore. Because Kaisa Kanyang no can. When you're mocking on it.
Jata tare saloon areren koninge snata ai telekaro tomo lagano loka Movit get more for less promotion udumak nyatanu ka Movit shin spray kede apron na titai arigwele jo Movit hair pack na isirigi lukumna kwa takeda kaisa kany osoda lo maroto molagano lai telekari toni milioni ni kanyilu iboro sui omwe moto kale gula narera kinyetanu ka Movit ara inomaka gula narana kinyetanu ka Movit ai boy city con oduma box con nareren abolo na neselo sa konye itona kaisa ndio bolapalo ikantare orurukunujo deri kiboreja asui osode gwele tiboro meri boriboro otia ya ledit nui tutubitai ngese tupitai Movit all day confidence.
Sorry about no network interference, Doctor Olaro. We still get you kopokana ano anyunbe. You're really loud and clear. And we Teso ami sikin kede itungale pupete program lo toma boyson regelegela utaja alimokin sonu kamnara kede pola consumption of the vaccine worldwide kede dokwa na alimokin oninwe jasine toma Teso.
Abalango be kopokwa nabe now it is quick iwongon o Teso ebeta konai ainya kunu vaccines ayanga rine eje asilo ikoto ikonai ai tosom edo peterai kabere maido bukedia palisa keda amuria ejasi kedi vaccines which toso iswit bala amkete kosa ikonai ai tosomari vaccines muneringa lapa la ikona kinai engeta kina ani inya kunu vaccines mun means kwanabe ekorakinolu ekorakinen imwachite bobo ejaiti de shari enamba la ina kino nara ina kina iboiso ne nitoso maite nuipo so yangune na chonus kwana Teso nesba kwana be ya ina chika waraga kwana be can we get tungalo o palisa mobilize them economy and the arikakini vaccines mun acha makini kwana be ngini tungana ni rai kare to muna kanyeuni even students should be vaccinated. Teachers, all the non-teaching staffs, all should be vaccinated. So vaccines are there. Actually, the next 2-3 months, we should be able to vaccinate over 1 million in Kenya. itunga. So it depends panave eponebani ibina itunga. On the testing kits, I think I will still leave Dr. Tolu. I think now testing kits are available Tony Health Center free. And I think Soroti should be having a gene expert to be able to do a PCR. So back to you, moderator.
Yalamanoi, kededobera jaun Dr. Tolu hada lomunto mo studios ne, but I know Miss Nora must have captured some things that she wants to respond to and give her deliberation. Then we give time to Dr. Tolu, who has come in here to share with us this discussion. Yes.
Charles, let me start and go straight to the point. Ber kapebala ebakare tunga no palisa. Ikatunga no palisa. Ikadue inachan no papa no ija no atoto ipuputesi ebaka jukakine se dozi ne kato kwenye mamiesi utasi alosta dumu ni ekato olototo dumu te kato na ara eko akane kota adema reki yangu na yangari ne jasi tunganu ekoto se kato yongako okus adanga dumu ne kato mama tionisikere ne jao kato iwonyasi tetere mami nyakaro okekia no palisa no bukedia no amuria no akabira maido iwonyasi ipali okesa omete kato kwenye mamsi kota dias ijeni sobe koto soyesi akusi ijara kojayo ayala manoi. The people of Palisa, please go and get vaccinated. I am your daughter, you are my brothers, I am your sister, my aunts, my uncles, you are hearing. Please go and get vaccinated. I understand the vaccines are there and you are not getting vaccinated. I am vaccinated and I can confirm that AstraZeneca did not have any negative effects on me. Please. I really would like to thank Professor Omaswa for acknowledging that it is not good to be beating people. And why I konai adumunikesa I tupu stop. So Professor Omaswa, thank you so much. There are other ways in which we can get people to cooperate with the standard operating procedures without getting slapped around. Professor Omaswa, I am your daughter, but I still want to emphasize the role of government in fighting this pandemic. I would like to jump to what Ejakait Opeitum was talking about. Ejakait Opeitum was talking about masks. And he said that you find people, they use the mask for over 1 month. And the mask is extremely dirty. And most likely even that dirty mask is not even placed properly. It is placed under the chin. Akotongon berat achamoto. Amaske gwelanarobi sirigini masai. Ilukuminiare alailoda. Okampala de rainyo ilukuminiare. A mask costs 2,000 shillings. That mask is supposed to be used only once and thrown away. Itungabi masai okumi ongora osoroti edumuntu osilukuminiare ino eperoteke sagweleta mask ngini paran na inap anaite bwauni aikopadekana anerata beiti mwasaibo oma mitunge pedoro sagwelu ni nyamata nwe nyamete oma mitunge pedora I touch ekiani mukeri kokiene deka pedori chititwe na lemuni lukuminiare agwelu na masking in. Let us be realistic. The cost of the mask is 2,000. It's supposed to be used once a day. How many people in Kumi, in Mora, in Soroti, those hotspots, have that money to buy a mask? They will end up, as Mr. Ejakaito Peitum has pointed out, wearing a mask for a whole month, washing it, it becomes threadbare, it is extremely dirty. Possibly the doctor is in the room. He will tell us, possibly even transmitting other diseases to these people. Let us be realistic. If we are going to use masks as the main avenue to stop the spread of COVID, the government must provide those masks free. And it must provide free masks for everybody. If we are using the disposable ones, the government must be set to buy 40 million masks and give everybody 1 mask per day. Is that sustainable? achamuti epedore government agwelunu na masks ngunu milioni ninu itunga no Uganda kere aina nakiningeni parana mask epedore mame pedori nesa bala rongo be abongo silaje alimuni be ejai kwa na gene expert a machine at what level is it na raji gene expert soroti bon ora ya une ebore sample anyo na nelo anatoni neja isoroti elomuni bationis arinne peta kolongo be mame munaro siborumu so ekoto ana chamun. So gene expert machines, for example, are the same machines that are used for testing for tuberculosis. They are the same machines that are also useful in the fight of HIV and AIDS. Uganda already has tuberculosis here, killing thousands of people. Tuberculosis is killing more people than COVID-19 has killed, I think. It's killing them slower, but it is killing people. HIV and AIDS has been with Uganda. Why don't we already have sufficient gene expert machines countrywide? Because we already have diseases. You can imagine if this COVID found us when we were managing TB well with our gene expert machines. Aro jasa chuma na ngunu, nepederaiti som, anya nari tuberculosis, ne utakuwa kanaye yari tunga ade kangin na awola. Aroja sa chuma na ngupo ngunu nwe puto si nwe pedo rai ngarake ni tunga akirono adeka na esilim tikwa nao ne covid epata na bi yataki no ne covid da achuma ngipenyen do kwa ne wuto na kerit amota chuma na nuti kolosek elo mutwai Uganda anwai ngarake ni tunga konyi ibo rengini Professor Omaswa alipitongobe achuma ngin erai nebe inoi mame pedora remu na chuma nginai otunga e government ne se beta gweletenyo achuma ngin e government ne se beta bikaki na chuma nen alo sete do kwa na so iche kati ayongo a cultural anthropologist na lo sitate maro ijabi akata chuma ko yapi inyo achuma ko nyema mo ina kinonge musalaba boda kijao palisa ko yangula ilo ne se ja chuma Kampala yangu neninyo ationis. So Professor Maswa eje role ne government achuma na ngune wanyanarete akowe government. Kato akowe government. Kiano inakini 20 anwaengara kini 20 ITG ade kangini akirone government. Alo matadoko ano wai wako. O wai wako da mami dari tosibe ainaka maski bone enyamat ikwana neo Teso ebakai ejaineni be atupite inono no Teso ebe kilioko be sap neseina na kinonyo alop elo seta lupo eda unoso Teso dokwana ache ngorongunda atwano kilenike abuona cheke kilenike ademari anyo akelop ayangunu be kwane ekoto ya puripur ipoto esikilio kademara ngora lupo nuleme kore netenyo angor akorunyo inyamat dokwani inyamata no Teso be poto mbali ebune pik ebore edakite cabbage konye mala kwame mame arere atunga emagira emame emaido emame tunga no ekoreti nyamata ngor ademanari nyo alop ekoto bero na lo stenge nada na are bake adeka na covid na idumu jo chuti egogonga koni kuwan you are nutritionally strong, your body has been receiving the sufficient nutrition. COVID, the chances of fighting it are high. So we should go back and look at those things that are also contributing to COVID being spread heavily among Teso. I have spoken about the patriarchy. You find that men in Teso are abusing because that is not the custom and tradition of Teso. They are abusing the customs and traditions of Teso and taking away land from women. Teso culture has already provided that women must be given land. If you marry, you must give your wife land where to produce the food. Teso women are the ones who produce food for feeding the community. We must go back to that conversation and see land use rights. Etwana papaka arayonga pese idemajo nga ka loop iyanguti jonyo ationis naronga pese aina kinongo na koreong yonga muchalat aina kinongona koryongi kanyamat ijaka etapita koriborongun ne moerenyo isirigin. Men are concerned in farming cash crops, but it has always been the tradition of women to farm food crops. So we should contextualize the fight against COVID also on the nutritional levels of our people. How nutritionally sound are the bodies of our people? COVID is pretty much a nutrition disease. It is what you eat. COVID-X, which was developed by our own here in Teso, is pretty much based on boosting certain food values or certain calories or certain nutrition levels that are supposed to be in the body already. So COVID-X is providing that we take that. But if we were taking some of these days it is very popular. Lemons have become very expensive. This is food. So COVID is pretty much a food-related disease. If we had good food, we can fight COVID. If we have good food, our bodies can fight off COVID. But where does the food of Teso come? Normally it would come from the land of Teso, farmed by the women of Teso. But increasingly the women of Teso are being pushed off their land, and now Teso are having to buy food that is farmed from elsewhere. Now, I'm supposed to buy a mask at 2,000, and then I'm also supposed to buy food for my family. What choice will I make? So let us be realistic as we make this conversation. The most sustainable way is to fight and get people isolated when they are quickly diagnosed with COVID to stop the spread and then vaccinate the population.
Okay.
Konya maski be.
Yalamanui Miss Nora Owaraga. Doctor. Yalama saja adolunu kede so tomo program lu. Ido dumudo jo kwanaso jaido toma kidding nada wotara reonokin neswama pugan polelo miatari sulai isulai ni koto aneja situnga dikulepe kanwa itiji adekana. And also we are also trying to integrate other factors lepedota ngarakin tunga no itiji adekana COVID and moso angale unaitunga kapo iteso. Well, we want to find out from you kwa petwane jaito makidingot na adekana boboda iko nepenen. You are a very experienced person in terms of understanding the human life. Yes.
Yes, so yalama panelists who are here, Kota Shalamkin, Professor Maswa, the Dr. Mularo, for giving words of wisdom. Akotungo ainakini atekera an update as far as Teso is concerned, being an epicenter. Ijai akironu ne rasitunga be aitunga lu ejasi ne rasitunga lu walking Fakti bian tunga lu Apollo kono ilo Teso murok no mentenge sim do beri tungi deja e ponto so o capturwa idi bo ponto so lango e sweet bala baka be jao ni tunga lu de casino ne konye ori tunga lu Hawaii. So we being declared an epicenter, a rai na rai, we are, for lack of a better word, a national referral as far as COVID is concerned. So katunga lemo na teker igeune muke COVID. Okay, treatment center lo soroti emina situnga noi o Uganda kere. Ila pione peta yare unio kau ijeke ditunga la pone nente o capturwa. Hapo nente Palisa, hapo nente Busia, Tororo. Using a polejara tiana peta na puganti tunga unu kere lo stembale. Idumne tunga chela poto lango alaije amulata lira. Unda kere lo sete lira. Jichela ponenta laila mudat. Unda ti lo sete moroto. Konye hapo nente lailo. Na jare second wave kota down. Itunga la pone ndo kingada mambe pote kwane lailo. Tunga la pone lemo Palisa Busia mambe pone lailo. Nara kwa nadishare COVID boys o kes. Mam kwa nijadumu ntungo lango nara dishare COVID o lango. Charles idumne no ni tunga la pone toni jinja. In fact, we got some patient appointed from Entebbe. Kwenye kere kwa me ponde lailo nare adishare covid boys okes kopani tungalo jasi o treatment center o soroti eri tungalo teso bon ilo majo wodi kopani mami adde kan je perikito wodi le buni tokinga eras lu keri tungalo de kase covid o rasi tungalo akai lo tesane i district ngana kopana lu pole covid akere ngesi 10 ngora serere kede kabere maido 4 top districts mamera yo metungale poto kabere maido Katakwi okapele biong amuria e just le ponente lailo but in terms of numbers tungale de kasinoi e ponente no district ani won 10 ngora serere kede kabere maido just to emphasize itungale de kasikere eri tungala kai lote so number 2 itungali pernikino wodi kopana itungali kara kaisa kanyape aloste kuju itungali mojo ngari tosinoi number 3 itungale jaso wodi ngunukere mami chumto se kato la covid-19 in fact itungala twake covid osorota ne edobe poloni bono wotwane covid do dumute kato la covid-19 e poloni ngari kara kaisa kanyau ni kanyare labundo kapchorwa adumute kato lo sodit odune kato lo yare apaka no kato lo yare tu sa parasa ngasa yaunde resore perikin itungala twakata osoroti kere e mame ene adumute kato so de kinai so that when accept a case dopiting on. Why am I saying this? Ninyo kenera nga kerono narai aja akirune rastungu kawangi na bitungala jasa twakere nisla dumuto sinyo nisla dumuto se covid vaccine e mame oni berotesa ne e mame na twana do dumute nyo odumute kato so itungala jaka ipernike na dekis mame dumuto se kato e mojo ngari to sinoi do rai tungalo tesa ne pane ngesi jawne perniki na lailo ngesa ina kina pugan e wanyu na kirono isula ilu ngesi na kina pugan e lapedo pokau e limore Teso as an epicenter mama pugan e pera limora kirongun mami soma ite e research mama pugan e pera no e soma ne pronouncement ka ngon the double check the yongo la ja on the ground tunga bane jaka iperniki no sakoto ngona misi kisi mamulu weri tungale ponto sa wai narai emitu matemar ba ngunda mamera itungala pa ne ditungala le lwaka konya jeni tungale pere ngo chaloi ibian ajaiso keditunga ne peta iwuni la jaka eda ajedo per ya ilo seda 10 ajelo seda katakwi ajelo seda kapele bion itungala toke tonyo e covid-19 so chapakto no down na nenga sinera ba mlu erasi tungale pote loteso konye twenla jai kwafungi na jeni be e kosigira ndemutan idaisa parania are covid itwene mutan e jai kopano rejaka mukeo re e covid ona jakose mutan e ja dekis no soroti perikita kede covid so etwene lo kwape misikit be komade kana jai ke doni so irayo on epicenter anuinyo iraro on epicenter anis questioning on mami jaikede the very clear definite answer konye akoto ngona misikisi oni bere kopano o Uganda kere nisi poa katare tungaliko tai lwede kase covid-19 mamere tungale pondo za waitin itungalo pane oteso konya kotongo allow me just to attempt to answer that question anubere nyo ipoa katatu ngole deka se covid neoteso statement number 1 la geningo ebuni doctor laro at a certain point ibun sabungu ne alimo ina take konya kotongo alimo ina take in passing be ejibore ne baka be variants e pole juljula re covid ajeningo misikito ni oni lu chibaki showmit bibor na baka be delta variant ngisle de nga kere eje variant lo eja ka ngikyunu ba leja Teso bon and e recoversto go ngora kirongon but when we confirm ibuna bong la limo ina atekere. But I want to give you preliminary information. A sweet bale COVID leja iteso itegele kina ke de COVID leja I Kampala, for example. A sweet bala lokolo eja nyala to ino nyala to adepari la why. In fact, ijai kopana samke the team lo Uganda Virus Research Institute. And it looks like it's going to be called maybe a Teso variant. Na so ditingin jala kinongina anin. Ayaret aninye polo re COVID o Teso na yaret iroko ni ija eda itunga noi eda kapa tekerno Teso ije kede nono we respect tunga la twaka ko idumun jo bene jararo ni sepuitunga tukosetunga mamitu ngapto sa masks mamitu tuchumto se kato la COVID-19 mami ngapto sa mask tukosetunga on angor erab angor erio rangor dunyas ke da test o ya pionoro noi mami ngapto sa mask gido petu na leke COVID pero aware ni jitunga lipo akotonga limo inoni anito gumore point lo yare tengon ija kai lopono yaona aparani ya de case kware sani yare la kware kede COVID yerno no yepo segwek so kwam konye no iturura parasa ne peta uni ukau uboja kai ngotoni atakeberu COVID da beru no botwana ilosa lemu no kumi ija eso roto kede omoto ambulance utwani roto. Very painful story. Jatese mocharelo soroti o yaone to kliniki aparania de kanoi gwekitezo kwam konyine itururu ngesinata Charles ekale after 1 hour abule na jaingo be kwana doctor ichama kini joso ayangari eja kaitilo eda keberu moi etwende jokwam 1 hour later your request to me, will you allow us to take this man to bury his wife? What does that mean? We value burials a lot. Abuna limoite kal. I am very disappointed. Abalong bites na limo ngobe okwe doctor. Ingaraka so o yuajara ngon. Sire tup no waike no bilanyoni. Konya lipa ne kale. Achamaki ni kesi o yanga singesi berida ke bera pakne tupakini. That is just to show us how much we value the dead. Because of COVID, and we COVID alo atekerno Teso, ejaibera kiro ne beit beron na ipala. Ejaibera kiro nite mariberon be idaraki si ber na rijao na tionis mamo ni ibuna sama kiro kale msek na arai ijao ni ationis ne polo. Ationis ne polo bereko pan ngesa dekana ne we ari tukunoni ne pepe ngesi mame kotore tioni atuko ituko kinoni yongola deka amangapta mask aware ngoni just luche dalo ya peteke dengo ngunda mengapito sinyo amengapto za mask orova edumbe mambo ni dum te katoda oraoni ationis ne polo 3 ejasi sokonin ejasi isokonin luma muti e chama kita iber to sokonin lo baka be weekly market lo rai onati pesa biti abonguti sokonin ngunoni Teso ni dona tuko kino sokoni alo sagweli boro agwela na riboro mamo ni ngapta mas mamo ni chumite kato ora ona tioni sine polo na angonet kirone kato ibian na angone to sabita lopa alola ngeta kinilo apuraja unoso meeting osota erero risula itunga litumto sikato in terms of districts or regions. Okay, region lo Teso is one of the lowest in terms of vaccine coverage. Ikidio kitunga lichumto sikato and kana nero Dr. Laro ejasi kopani district ono Tesa nele kodro nyakarekia anga district aniche. It's a very sad thing. Be oni lu ejariebo atingit adongite kopana ije koto balema rekata ni jaoni aina kini kui luwera madeke polo bukes akoto ngesitike na tekerno Teso na dede ngare covid o India ekiale baka be AstraZeneca ebuno India AstraZeneca re company bolo nero zakara unchazo kawangna bere company lo UK but it manufactures its vaccine from India. Serum Vaccine Institute of India ngese polo in the whole world konye na dede ngarare bo India potemas be mambo singa ina ikelu ni just chetunga we are going to keep it to ourselves first. Why nara jatio ni sore because lo India mambe bo singa chetunga kono bese mke kostunga. How painful will it eraine true nintu mangara babe edenge teso konye bo teso ngese kale marekia aina kini chetunga lumimi kotai lumama ribe polo notunga. So kapa a coordinator of COVID mama kero put a somaun we are going to drum up, we are going to see how to make sure itunga la muru ya loka bermalo palisa adumute COVID-19 vaccine nari jeno ni oni ateker emame kiali muki ya ribona ber there's no cure ibo reboni eni beri jeno ni ngarakino ni nese kato la COVID-19. So nyutube ngarakino kitunga Charles aposa tamate rerio anu berenyo jeta ripolo kopana dekisna polon kede COVID mama dumuto se COVID-19 vaccine anunyu itunga le polo tosulu e polo karaka isa kanya una loste kuju e kotokini duelu didiki sap apesure ngarakini ngesi alosta dumune vaccine alosta dumune katu ara mama ni ngarakini mara mjinga rakini twene polo rit my partner dumune kia ekato la COVID-19 akona sitikin Charles kelate care nige une the current bachelor I mean astunga lo say boy adekis anyoni san won tubaka dumune kat san kanyango epere polo na boy pakisana ngunkere idarte kato. So kape region kota ngani bingara kini polo tungale polo ritosino anadumu nyo ekato la COVID-19.
Yala manoi do kanado okapakida utalosit nara ikoto adomu tuo okotungado kwa pangina lo saya unonu keche au misho Dr. Torungon da jekine noke einer dodo Dr. ngisabere ni kamnara kede statistics nun ebe epone bani edo antari statistics lu nara idumjo kate peri Dr. Limuni Kesula ne dobo Kampala ejai epone lobo itegele kinatarwa nginada isulai kwaje tebe program la jaito mo studios ne poteng angisto sakrongun ebe epone bani how do you deliver those statistics teterekwana people would be able to know ebe if we have got some information from Ministry of Health talking about a certain figure then that means down here should also be the same or a different thing altogether.
Yes, so yalama noi ngini paran as a region isula itungali nwakuno kede COVID kere jukar sakerongu Kampala on a daily basis. Kampala aggregate sakerongu kere then the Director General of Health Services ngise weari be lolo apakini koni ne tungi muane apuri nwakuna kede nyo kede COVID. So we get nwaki situngo kwa palailo ijukete sula ingina ito netwani lolo yukar sula ngunu Kampala. So information is from here olosi Kampala do Kampala is declaring ngai. So that means information leo Kampala should tale kirela lailo. Kwaen.
Okay. Well, let's first pay the bills. Doko nyete onabongun nambale simere not uni kanyangon yare kanyon wongon not kanyon keda wongon. Achamutenge just messages da utitunga ya untomo studios ne just yelu edauto CIB kakintoma Facebook chebika itostoma Zoom eja sichelu da ya utostoma SMS keda itungale lose kwa na aina kinona pack na ino msimun.
Lekai lukumina kwatat angoni sabiti otoma bolobolo na 545 jackpot i-downloading a Sente mobile app o Google Play Store o seku Sente idopuka account o lago imormornos kedi lukumin agwelak irwana karaibo adeparida itwasama i Sente mobile Sente Visa kede Sente agent o dumarere nguna itelekar ne nyiko kina ja bolobolo ngesipo akatajari mushono itelekar anu angun olomato ma bolobolo na 545 jackpot itelekai milionin angoni parit keda angoni sabiti Centenary Bank
at our security systems we assure that your security is guaranteed. Bank on us to protect and secure your interests. We offer services like K9, VIP protection, guard services, electronic services, surveillance, and so much more. Contact us on 0392 178 100 or 0707 531 000. Our security, we got you covered.
You can bet and get paid using AbaBet with any phone, however small it is. No need for internet. All you have to do is dial *185*60# on Airtel to get the AbaBet menu that you can use to register yourself on AbaBet. Place bets, deposit into your AbaBet account using Airtel Money. Withdraw your winnings to Airtel Money at any time, day or night, or so much more. With the AbaBet menu, *185*60#, you have access to unlimited games and betting options, all free of charge on your small phone. If you want to use internet, visit www.ababet.ug on your smartphone and enjoy the best betting experience. Always dial *185*60# on Airtel to bet with AbaBet, and you will not regret. Any phone works.
Get the MTN Kabode smartphone and pay Pola no stress. Dial *165*5*2# to know if you qualify. Then rush to your MTN service center today and get the Kabode smartphone. Pay for it Mpola at only 5,000 Uganda shillings per week for 6 months using MTN Momo. Terms and conditions apply. Everywhere you go, MTN. Be aware of conmen. Only accept calls from MTN on 0312 120 000. MTN is regulated by the Uganda Communications Commission. Reachable on 0800-222777. Toll free.
It's amazing how delicious Tip-Top bread tastes.
Tip-Top bread. Add it again.
Tip-Top bread is the oldest brand in Ugandan market, established in 1956 with a range of products including different flavors of loaf, buns, mandazis, and much more. Tip-Top is certified by UNBS and comes in different colors like white bread, premium bread, brown, red, soft cake, and salt bread for those who don't take sugar. Find us at our main bakery in Jinja or our branch here in Soroti, located in Oderai, opposite Goshen Primary School, or call 0759 722 126. Tip-Top bread.
Farm Solutions Africa Limited, Ipadichaskede Kao Agrobusiness Limited, Kwesi Yanga Utosijo, Cabbage Optima F1, Hybrid F, Lodama Me Walk, Ipiroja Ibirie Tungananda, Ibiruna Kune Langir, Naikilosi Wongonton Ikai, Elingakina Tunire, Otoma Parashak Sakanyare Kanibon, Pegaskeda Kolong, Piroja Raikinton or Telada, Mama de Casine Ikamunete Ngesi Taitai, Ejabo Kweskede Watermelon, Loenyareta Trinity F1, Ejasbo Kweskede Nyanya, VS63, hybrid, loda itija de kasine nuitirinyete nyanya, etiona tipet, ido iperoja isaka adauna ujau, asusuta diope, etudumikini jo ikilos medo tosi tomonauni, itoni tomonakany, boboda iperojo aitolota adauna ujau, oma meke mukula ichile chilona, ejabo kweskede green pepper, ichokolo etulelut, eja kweskede bolia, cold chance compound, ejokanwai tutuma aturo, kede araito adiokere, ejabo kweskede NPK Purity, idumakini jokwe Soroti City, Diego Road, take the deeper stage, Araimam, inome simenaba, enoti kanyari kenyuni wongon, ikanyuni yari, ikanyangon ikanyape yari. FAS Seeds, giving technical advice to farmers.
Anyoni na remune ngototo kaking, alolenga anyuni mumuade pero. Raingone Company, lenyartai Akahama Enterprises, we just like Mbarara, Esoma Kimatin, Kwape Nkore Banana Donto.
Isoma taikeda imumalu ore, juicy lawyer target.
Esikelao, nepepe keda rosemary. Ido matajo, ejatar keda sane jokonoi. Ele mara ibinyi kitena kwan.
Osodikin your trust kombucha. Nyesi sama keda akipi, amajani.
Esikelao, ejinga, imatene nguneskopani kamutu sakim.
Nkore soft drink, nyesi sama keda jinga, enimu. Esike nepepe keda akipi.
Tatat, kopana berongo de ado.
Imatene lu, nyesi dumakini jo, Juma Bay Road, and also Roti. edon kedo weni clinic karaimam inome simu enot kanyari kanyeuni iwongon dopet ikanyari kanyangon idopere kedeuni araimam odumako dukai ido supermarket dumias keda jo anatar Uganda kere
imatre luka kahama nyesimani mante luka UNBS Akahama Enterprises Uganda Limited. Just the truth.
Supreme flour comes in both wheat and maize. Supreme flour is very nutritious, tasty and healthy because it is fortified with 9 vitamins and minerals. Supreme flour stretches easily and uses less oil, so you end up baking more in less time. Find Supreme flour in all supermarkets and shops around the country. Supreme flour is manufactured by Mandela Millers at Busega Roundabout, Masaka Road, a product of Mandela Group.
It's 4 p.m.
Gentleness wakalo ngesinu mtijo MTN itasoma pointa na konuka MTN senchu osodijo adumu na minatu luka titai MBs luka titai arai imessages luka titai ichika star idopet wongon dopet hash oseku use points osodi atupaki unitubitai teteri dumuni aina kinede kon naka senchu.
Everywhere you go, MTN.
Well, raikwanisa na itomon lo atibong kepolo bijaida ukana ni tomo sawa la washa lo program wakolo ka TesoGang do tomo studios kwape geunoko program Professor Umaswa ijai tomo line Dr. Charles Olaro loda yaita krono General Services Health Services otoma Ministry of Health ijai toma kedo na imore program lo osodikine Stephen Opeitum ijai kedo ni otomo program alo. Miss Nora Waraga, cultural anthropologist and managing director, SIPA Uganda, a non-profit organization. Ijaine Tomo Studios, Anwemorokero na Kronu. Dr. Tolu Wilson, physician and a coordinator of COVID-19 in Teso sub-region. Ijaine Keroni Aimora Kronu. I want to have 2 minutes with Miss Nora. You know, there are some answers that have been provided for your questions, like the issues of masks and so on. Masks, I mean. You realize that we introduced the reusable masks. To avoid the issues of 2,000, you throw that one, you have to look for another 2,000, you buy a mask and throw that one. Don't you think that one can work?
Well, it could work. And I use reusable masks. But the quality of the reusable mask, does it fit the standard to stop the spread? If the quality of the reusable mask is just a thin material made into a mask, I'm not quite sure it's effective. And Doctor is in studio, he will tell us. Okay. When you do reusable masks, what is the standard for us to tailor reusable masks? What is the standard? And again there, if we are all each making our own without having a very specific standard, we are defeatist. So the ones that I see commonly are actually the ones that are supposed to be used once. Those are the common ones I see on people's faces. The reusable masks, if government can produce a specific quality standard that Ministry of Health has verified that this is it, again, and distribute maybe one to everybody, fine. But what I'm saying is that the government has a role to make sure that if we are using masks to stop the spread of the virus, we must use those masks in the way they are intended, if it is to be used once, or if they are reusable, they must be produced to a certain standard so that when you wash it, it does not degrade, or that also people are given specification that you cannot only have one reusable mask because you have to have time when you wash it. So a kote government ichuta lomu na kero no mask. Adonyi no ngona ka haboni fwa nini. Mamerai kote government nesete maribe a mask e koto odonyu ntete eponeno. And I will give you an example. The government can actually create jobs by working with those very youth who are now not at school. There are very many innovative people. I've just been on a tour in Ngora of the work of SIPA Uganda. We are doing research there. And one of the young persons there who is innovating is actually teaching people how to sew using a sewing machine. So this could be decentralized, but the specifications are monitored by the people from Ministry of Health, from Soroti Regional Hospital, to make sure ebe a masks no edo nyuntai e rasi no edo litosi I boro no echamuntosi atomasi edo nyuntai tete kese pedotai tibon e jadu mune COVID skeda joda e kopaki ni chetu eninyo e COVID. I give that back to the government, and that is why I say I wanted to comment and say we have very many youths now, innovative young people who are educated, but they are considered unemployed. They are with us in the community. Let us use them, and I'm hoping that they are the ones that are being selected to be on these VHT teams, village health teams, especially to manage home-based care. I'm sure the doctor will agree with me that when we choose these VHTs, if they are educated, as one of the LC1 chairman of a Ledai village told us yesterday, that people who have tested education have a certain way in which they have an organized mind. And he was encouraging us that they are those people who are there, who are educated in the community, good people, whom we can actually plug into that resource.
Okay.
And this one we discovered when we're doing a very important research of actually challenging the category of educated youth who are considered unemployed, who are considered disorderly, who are considered idle. Those are the people, they are in the community, they could be very useful to be used as village health teams.
Okay. Yes, doctor.
So
now, there's a Jakonakron no masks no, and how people are supposed to adhere to the SOPs. We have now schools also coming. We are talking about health and COVID-19. Mamga jeni kati ona tesa ne ireki bereje pole jata rikupokwa na isemeroi. Ipedorete ya tupakin ireki popoja wa krono. Namba lo idue lukwa nebe tunadu mnoto mosomero ikede pole adu mno natari mwalimu ne kato mamga jeni are koti statistics ya nwe kamna rakedi mwalimu lo adu mtu ekato. Then the issue of these masks here. You would tell us the effectiveness of the reusable masks without compromising the quality as Nora's stated.
So yalama noi akotunga gia limo ina atakere na ijaro studio ne alimoki na atakera kroni kamto se katula COVID-19 jaine peta ke di group ni kanyi ni geononi Charles na so diti baloni be muroke da nursing health workers na yaret caring ke di policing na ngonet itunga likaru akaisa kanyaloste koju kanyet itunga likara tomna kanyauni kede akaisa kanyo dekase pressure dekase sukali odekase asma odekase sen ngesi ebeita dumune kato abunge sisi yaute berebo pachi tunga iche bakase yongola deke pressure mam ngebeit konye do kopana policy wokapo Uganda iraji karatum na kanya unaloste kuju oloradumene kato hari dekaje pressure ara imam as long as raji karatum na kanya unialoste kuju awanyu tuve dumuno ninyo e kato. In other words, a kato is for everybody now above the age of 18. And chatsa koto ngoyata kini ai gwekine message lo puputi music situnga kirono araji karatum na kanya unaloste kuju odumu e kato la COVID-19. Age arimo yi araji karakaisare odume koni kato. Number 1. Number 2, akroni kamuto sa masks. Apotu adumuta masks nubuapugano yao oni teso ne. Pota kora sa masko district na lo teso kere. Kunya jeni ngojichi atunga no moporo adumuta masks. Yaret a masks no poto adumutu amuna rose kwa na apotu aja unoske de program lo aporeria munoske di tailors lo soroti and we task forces kere lu o district and lo teso area munuke de tailoring people or district na kesi dainakin the requirements lo adumuna masks, and once we trained them apota misi kisibe quality la masks la poto yaonai arai la jok na arai a mask na tazama mkopane na erai a medical mask ne betanga palo la chakaringo mamuji pedori etosoma ngino re. In fact mask na rengun adopet ne baka be medical mask be to soma dekis a cloth mask le rego engone be to som ya yore o in the community na arai mame patana kana na limutori o aragane ai patana jo akwiri na mask ni chakarong ngini para mame patana arda di soma ita me pedorete na arai ngini pak lukumini yare puisula ngunu no so ngesi balarbe ari jajo keda mask ne baka bene goyengin to suma bereja masking in ngara kini jonara e karisongo akipin de dasingun e salakineta oguengon mamnge sharakini ne jasi tungaluche ngara kini tungaluche da yongoda la jay kede naka ngara kini ngo ari shar no suboro ngunu kinga konye message la limo itoni miss warag ngesi be yangar soka pe task force is to continue monitoring are request to be those the qualities that we gave them, but indeed as task forces in Teso we met them so that inakini kesi the steps in making a quality medical mask ngetakiningo itungale twakete, and I'll not get tired of saying this, itungale twakenete kede covid keda de kasini acheda eri tungale ya pita yao na the case bwana baka be they have come in late inyo bere yao na kerono alimo kini jobe alimo nji Charles ba ya pa yao na mojong tamiso kunye nyiwe mina ina kinoni ibuni oda ota paka tubu iborenge ena jenunge siyenta ade mame covid erai tuene darabera kwana chut toni ngero kina kwana noi ngise buni tuena dekis o di kara dekis ngeno medical ward e jairu anare jeo e section langor je section di kiliok dunyu be section langor lele basa ngoro kwanta di wanjo kesda medekasi noi konja loso section di kiliok mami kilo ke pukoyi kilo kole jasingi na de casa depart anuyo na rebe tuna vera uta keda kwa no reangina engere do chot ngese yaw na rade kis hade kane covid na amere chronic illness era de kane buna tipe so ebune kese bale turu yobe bale turu lopolo mambere rono noi echa dojo kwa oyonde jade kisa dumunu be adamuna riboro lotoma Charles sabiti ni wunyo kawu apona nera tane, and I'm very happy for one person that called me apona limu be ni chelu oteso so mai Kampala ejaso ki uria ko chalo mamjeni bikon be polo nai abunga apona limu sa take be akotonga siniko kina take ari jajo Kampala inomene bereje simo rengini paran e wala to le polo ni biye alla mo jongo biye e ja amu chalda do benu buisoma kwa no boyao ke uri akiyare ke de covid adekis aposa tura ta parania amo problema so kwa muda ubolimo ko ngobe abunga tupa kiro kwa no poso limo isingo radio neno mesimu ngini pak enge no mesimu limo itengobe ame polo ni wala trejok ke ngasa limo yanga sa dekis oya onta dekis no kundeso ke de covid wani mama de kayalo manu agera samu kiana parasa disangale polo kira moja mabongo sore oria pitos chibakte twakata ilolo abuningo studio ejai ates otaum ne pene etweno botwana koyo po noma ina sesimu ba ye polo peja lo songina enwa kadumere covid ar itunga la ja so rengon elura situnga so be kwanesu anga sadekis mera rono noi e ka timu la bolo to ngina na jates abui kintunga la lomara motoka Charles oto mitungi kan iare aja sike de covid oto mitungi iare alu edopet aje kwa mukwapu noi we have just put him on oxygen la bakas bebie mamera rono noi ti kwa ne bongonde twana atekerno Teso apalas beroni akirone dara paka nengiro kana jako wana noi miso waraga ejitu ngale mina sabulene kede ngade kis lele bore kwana do be riebe ngone do jangiti be do bodi bore lele botinyo pala ber mambere ngene ke uteriebe ngo akepolo be abo ngene rakiri bora en arege eko nai arege wa riebe ngo apalasi iteso age otuberoni da abrina de kisi sek. In fact a discussion law abun bonga bong nener be tonado ketadi bunenya de kisaram jirie bada yam ngarie ba konye onye nasiberesungo
Nye Dr. Do very sirigin tacha adekes.
Tikwa na jasungu diagnoseta then icheborobo na repertoire na bune adekis then access is not there.
Ijai kopana atama engaraki no kitunga. Charles, because of COVID, yonupe joka kana jasabunere. Kopana when I was coming we are reorganizing. Anabunge nerete kachito kawa. Charles, mere tuisabiti nyare. Be mambo bo itwene no Teso ebuna lemuni kapun anu alemunu jore abuna dekis. Ambulance services are going to be free of charge, and that is support given to us by Ministry of Health and World Health Organization. Ambulance no Teso kere just get a card in no akinyet 5 million shillings. We got a project to support us. So ejake no pe joka without losing the point. I take care. Are bujo ba jepolo pajari ngakwan obi adekis. Enera Dr. Laro, it's true. At Boron in Wakere COVID, a just Quantum Health Center 3. You can access a COVID test to Health Center 3 kwana. O ni kwana yeke de PCR soroti ne mambo ju kiboro bala korobo bet paka entebe. Things have improved. So, nyituberoni be ipupu jo bija jerono. Itu anapo amite malaria, amite dekana kiring, amite typhoid. Yongo kwa nabunga limoita ateker. Ogeona iberale mare COVID wae. Ajokse just kwa ni test kits muno health center fe nwakyo tae. Ewa nyuma mere COVID inwakada de kasine kwada malaria nyo kwangen.
Dr. Akide Timo atenge otao kapakalo sita, and this is the last hour. We need to have a feedback aneja soko tungalu inometi simune noketi simuna ne ido achamtengo be chia tungai kutosi kwa na ngiti araibo achie neja Dr. Maswa araibo neja Dr. Laro, Dr. Tolu, Miss Nora here, araibo Steven Opeitum loda ijasi tomo discussion law. Sa kodo berengo na lo sitoma adumu na hangi setanu itunga keda umishoneo mtostunga nare nibika itostunga nare bala lolane bonebe ija utenelo adek keda ngaleu aneoto mariwa kona oteso idaona adumu figures kede pole jatarakro globally kede Dr. Maswa keda Dr. Olaro pole jatari statistics arabisule pole lomiatar. Doctor here has given us the situation in Teso pole jatarakro aneo Teso. Nora is here giving us the other aspect of challenging what the authorities, stakeholders, government and other things should be able to do to help people. And then Ejakaita Stephen Opeitum, he has also given us his experience kede what IDO is trying to do in order to give some help. And angara kide jautenelo angaleu mameja setung, especially Soroti Regional Referral Hospital that will serve Teso and the country. Se numberless mere noti uni kanyango ni yare kanyango wangone noti kanyango keda wangon pereja ya una konu misho. Yes, somebody says that it's a very respectful discussion, but my question is that now that we have almost the waiting Teso COVID variant 19, which variant are we currently vaccinating then? Is it still relevant to continue with the ongoing vaccination process? That is what Mr. Blan is asking us this afternoon. Hello.
Hello.
Yoga.
Yoga program.
Hi, Kirol.
Nara sijokere muluka Julia Muguti Ferere.
Yes, Muluka.
Kodonga zile kutra kirarero. Na soliti kama narakere no nera kwa bala bombe marakin lesi religious leaders kapa religious task force kwenye kwana konya ni ida unoriso bi jauno task force ni nare na soliti bikira soti ko kile tungada kapa na dum ni ko tunga kaisareda kota ile ndio mama kisile chama kile pone kwa nani pedara so atupono kitunga no ichura right kitai so ere kini no enera doctor to lebe ya peti tunga lo stade kis nese dum na tungene le bondi lo stade kis adum bondi ya peti chipako tuani na beite mamera bai ya palo stade kis pero ya lo stade kis konye chipaki luwa kijo chipaki tunga ni luwa kijo mami jendre luwa kumbe e covid ne sede ka tungana so imukira chiede ka be malaria be midi be nyo ke polo bondi ya tetuna ribo anyi na tajas mo kede adope kusta na para ke ngni so maiki sara mo jonga na mo jesu pe ngare sere na poni luwa ki bala bondi malaria mukete malaria nya kune tore pe covid ne sade ka mo jo so iniriki na mo jonga deka yanga tesoroti ibuni kini emina tungana na lo sai lo ke covid tiba kinya kune bala bondi obongo bere mamji nyabi science do motijo obongo bere do bonga chepa kone sati yo kisono jas chepa ka je polo pupulet no ye kwan ko hilo to boje no te bala ibulge nyabi science do motijo ni tes je bali go bongo bere re so dikini dona washa akotongo atemarebe ejai chia tungada kapana ti imuro ko la dekis kapana ti VHT iswamata dekis edo na dek mo akune bedeka mame buni aina kina kirongo le ko bisi boni bedeka nesi ne soma in sabna ataki adeka koraro tunga nesi iya tara deka anyara ne jafe tunga depa
yala manoi hello yoganoi
molo dio lo chapa ne serere
so chapa serere
abeide e chale se kede Dr. Tolu atiumusu eja nada apotuko pa ninu rokolu imukete tonge kato ono chapa ne rwana re jeso meronele makaisa primary school apotu akanyete ya anomi mwalimu ne kato konyogu eki angono sale balasi kwibe ari kotose kia potu emukia taso yesu konye raya musu anwai mukeji ni tunge kato egiri to si tunge kato nomo si che kato ebana si fibo limo si tunga uni lele mo senta unu wamsi pedora yakare kiano homo opoto ikamuta riremu yeni tenye limo ini jo kerebe muke ingo mamu effect ila anyu mutingolo to noma ke kato mami tunge koto si mamena yeni itoro borobera puga no style bani
Yalamanoi, and then Patrick Akobi, he says that good evening everyone, that I'm happy for the fact that we have Teso health icons in the studio, Dr. Tolu and other panelists, and I admire his character, and Professor Maswa. Happy for the submission. The presence of Ministry of Health too is also good in this discussion. The Teso being COVID epicenter doesn't mean Teso alone has many COVID cases. One thing we should appreciate is the effort every facility at lower level is testing COVID. They do COVID RDT for screening and PCR tests. This has helped in case identification. We all know for you to eradicate the disease, you must identify all potential cases in the community. They often refer to sorority unstable cases. We should thank the effort of Dr. Tolu and the team. I'm happy with the struggle Professor Maswa has been doing at rural level by community sensitization, screening and referral. He, Professor, as I know, has good network of VHTs in Ngora, and for sure even other parts of the region where the aim is to help identify anyone with symptoms and call health trained to intervene, which is really very good. Thank you. And still we want to have your opinion here on 0392840884. Ara iprejo ayukakin so SMS da toma onot kanyari keda ikany ikanya uni wangone not ikanya uni keda iari osodi dojo ayaun kona umisho otoma o program. Hello. Ngaikro. Simon Balajon kuna umisha yake.
Nenera emuroni na polon Dr. Tolu. yo pachutita pala itu ngakiro nanga parda mas kapani dulu yo katio ten panto dele mas itu ngawala ini ngomong itu menengah mas ini bila nanti lele batu sukun ini keranya ya esa bala no be itu ngapatu apa tada kiro ne COVID-19 bila aja.
Okay. And then Ali M. Soiti says Roti Regional Referral Hospital and other hospitals in the region, such as Ngora Fredika, have done a commendable job in the management of COVID-19 cases in Teso region. However, there are a number of challenges they still face. One, facilities to manage patients in ICU are still lacking, and medical workers still struggle to have the PPEs. Village health teams and task forces are critical in the health system and should be reinforced. The 300,000 that caters for 3 months, what happens after the 3 months? Doctor here, when we started the show, Professor Maswa was telling audience that government has released money, 100,000, that is coming quarterly, that is 300,000 for LC1 chairpersons and the VHTs to do their work. I don't know the connectivity that you will assure us that you will work with the health teams in the grassroots level to ensure that this is implemented. Hello.
Hello.
Yoga.
Yoga Charles.
Ngai kiror.
Yang nyam karon LC1 la abata.
LC1 la abata 10.
Abata katine.
Okay, katine, yes.
Ajango kedang diseta. Kwana kutonga jenu be ko corona jai resign CD. Na yara kini idu mojo wale jejo kire corona ade kisko bete aidan jo aga ngatara bo mam yalama
araga ngatane pune konya chamtengo baga ngatangisa ngati doctor will specify critically be aga ngatabone pone nyo ina kina atoma dekis twenler jasi kede COVID. Andrew Opeitum, he says are people aware, he's asking, are people aware that they can sew masks from cotton material? This is reusable and can be washed many times. It is considered to offer better protection. Yesabala Ejakait Andrew Opeitum. Hello?
Hello?
Yoga Ngaikrod?
Yoga.
Ekrod kon?
Martin Agia to loka tineralo lalai. Akotongo ashalang kindokte tolu no ya nunge sabu ekite itungalu Teso. Dado pati onu singesna bu ya pugano yao. Omo bitacha kitunga pola beto tadum nikatu. Esa na kitunga kuya na dum nikatu. Ta kiro na esa ni afom jenjonya atana ni sigora pipilo toma kwa pa kolonga kere. Dawa ta jasa ni afom no do bie. Dado ngeta kinete bie tanda sasa pro na dum.
Okay, and Patronella Ochom, she says, can the doctor comment on death after vaccination? If someone has healed from COVID, when do they get vaccinated? It's not just late arrival to hospital, but also complications which government is avoiding to talk about. Okay? Hello?
Hello?
Ekiror?
Ekiror nyamuare Komolo.
Komolo na ukata kui?
La Muria ande.
Yes, Amuria, yes. Balas nuko nai.
Ai salami kine Burundi box kuino ina depar. Epuno la kurenga salami kine ngesi. Atena ngona cheka molodia limuni kama na rakeda kiabe agiri kede kia. Ijulu na kia ngola wera. Nara itumalo ane ekade sekti akojera umoena tebonu begi kosi kui. Obuka omolodio. Ojukana sekia ngonite yakare. Mame sekia kota ngali bona rebu ayero na kia ngina ni sekia mukia utoriso. Enaramo kopana adauta na ptakadi ngine kia ngole
Yalama noi sodana kuna umishoit. Chris from Anyara, he says my question is, do you mean that people are vaccinated to receive the vaccine without even testing? Or that is what he says. Then Michael from Amen A, the government should enforce COVID-19 vaccination because that disease is an enemy of Uganda. For me, I have completed all the doses. I'm okay without any effect. Actually, unvaccinated people are the ones making vaccinated ones to put on masks. Okay, hello? Yogang no ngekro?
Hello?
Hello? Oh, like his phone or network is not all that doing well. Hello?
Charles.
Ngekro?
Yogang no yung molodio lo chapa.
Oh, yes.
Ini lo wera jita. Ekialo erare ngadulu ngatutu bete koni. Angoda monyiti ngekiala dauna ujau. Konya bubu da tuya ikini mwalimu ni mukeo. Enyi turi ngode baka ngobolo mo laina. Tepolo. Ana upele muda ujau ngini kerata mita kialo. Ngini deki sebala ya daun. Solo wera jeni nyodolu neki angoni nina. Ipu kunyo bado neki angono kero pero laina kiri.
Galamanoi. And then Edward Esegu from Amuria, he says, as Teso, we may need to push the Ministry of Health to provide a COVID-19 test to everyone who visits a health center or hospital before receiving any other form of treatment in order to increase case identification in our communities. It means maybe even if someone has gone to the hospital for malaria, let him first be subjected or she for a COVID-19 test. And then Grace from Arapai, vaccines should be brought down to the villages because some vaccine centers are far, making people delay to go for it. Okay. Hello?
Hello?
Ngaekiror?
Leo moding Madera.
Madera?
Kote bera ngoda jen nuane je doktor. Epone bera ne korakena attesti COVID. Nara chawe baka bonuwe. Tenenti lejari ne sikare tori. Arera mamila ikini mitare arika. Mere. Tado pana imikita itu ngai rekina testi dai dumuni je baka kwana. Em komplaini ngai tedi tungabi. Katung. Atese koribe COVID yi. Nara indo jo bonuwe. Acha baka na endo sai dai pungure je. E pungure dai kina testi baka re bonde trenen.
Yes, Doctor, you talked about people valuing death and the dead. So you'll have to tell us this afternoon and evening that, hey, how can the dead body transmit or affect others or give infection to others? Because one of the things that people always do is to ensure that they are going to die, to bury the right person. So they are not sure whether you people are giving us to bury the right person, so they have to first check. Yes. Hello.
Hello.
Yes, Ngekron. Hello.
You are talking to Nabos Nora.
Nabos, where are you calling from?
This Nora district.
Ngora district, but your network is not all that fine there.
I wanted to say, doctor. Hello.
It's okay. Go ahead, sir.
I wanted to ask you, vaccination, which one must?
Let's try to get where there's good network, then you get back to us. So Loitas man from Palisa, but right now I'm in Soroti. But for sure, when you go to town, you will not get people wearing masks. So my request to government of Soroti, let them force people to wear masks. Hello.
Hello, hello.
Ngai Kiror.
Chairman Opejo.
Yes, Chairman Opejo.
Guarna vale como le ve. Pero no mate cato. Vamos a ganar para esto, ahora la session. Dumbo yo, onda gira su papel, bata suero no se angon. Ote chora chime cato, bata chime cato, no mate sa indi cato ngon. La corona se lo pide doctor Tolu me ano ati asam. Konyeto ngon ta chime cato.
Okay, thank you. And this one, can go to Dr. Laro and maybe Dr. Tolu here in the house. This is Dan from Amuria. He says, I want to know which percentage has been vaccinated in Uganda because we want schools to open or to be opened. That is what he says. And then Grace from Arapai, vaccines should be brought. Okay, I think I had that message before. Let's have this one online. Hello.
Hello,
Yoga Ngaikro.
Okelo.
Okelo.
bunga loto hajaingo kata pi ngarelo kata pi dodo boyo pi loto chabo mada adumune kato dodo bere ba form na kolo na lipe dokti nara kije iso chema mimi sikini boro a consent form ngin maybe they will explain to us the BI Bakironegia consent form. I don't know bunga shome bakasi ariba iji twenty childbearing age. Araja bear kapare dumune do in the next 2 years. No madumune nyo ekato. I read so many other things. Arija sima respiratory problem. Mama chum. But doctors are not telling us. Me, I got scared. I just said, Mom, Kodavarana direct. Maybe I not the brain lolo so. Dear Rebala have from Nina and Kinitunganyo to sign. There mami tunga do kini so jasi madoja chumu ngesa.
Right, thank you. That is about the consent form that some of the lanes to be responded to are questionable. For example, that you have been asked a lot about next of kin, of ASO, and so on. So people want to understand that. Then from Dokolo district, this is Samuel. He says, how are people going to be helped without national identity cards in terms of getting the vaccine? And then someone says that if someone tests positive, gets a treatment and recovers, should that person also receive the vaccine immediately? Thank you. This is Jacinta from Serere. And another person says, I want to urge the people of Teso to go for vaccination because it's the only way to go. Those who are against this exercise still keep us under lockdown. That is what he says here. Hello. Hello.
Hello. Justin Wera.
Yes, Justin Wera.
Iborita show ijaibe luko jinom doso ID so someroi. Do kwa no so tes datu na tiadu mune ekato. Kwa nyima mende keda ID si kwa kindo na idwenguna ipokiti chunta kado na ekato. Le vaccine. Olimo kudobero ne Dr. Tola Kirong.
Okay, someone says, long live Dr. Etolu, long live in the studio. Thank you. And Voice of Teso, this is Lawrence. Lawrence, thank you for that comment. And there are quite a number of messages here and people are calling in. Let's check out another message is here. This is Stephen Kanungu. Ebalabone be isokoni ni ludidi kangun ngesikopo kwa na erai ichan kesareda kisetunga. Ilotoja dekisamu kian adeka chie meribore ikapun ekotoi. Osode tengeda eredakiti tunga. Imamedo onwe pedoretwane boy ainyamebo bon. Okay? Isabalangesi. And another person is called Eguru Daniel Ojomo Ochuloi. Shalamu kingesi Dr. Tolu Noi anoda ichora tekeri ebe la subane lope idara dojo keda enakine achoa nada ngaraketi tungoponangun. Pakwa koda utalosit nara quite these panelists have to respond to these comments and issues. And I know we have kept Professor and Dr. Laro. I want to begin from that side to make sure that we respond to some of these issues and then we shall be able to summarize and attack in a program. Let me begin, Kede Professor Omaswa. A number of concerns and questions have been raised here touching government, individuals, and stakeholders. What is your comment on that? Ngetakini kwa nadoja program law keda alimoki na tekera. And more so, we want also to have a word of hope because we know we need not to lose hope. We should know that there is always life and life matters. Yes, Professor.
Yagatamite arionora kirono kwenye niagem aumit ekot aderoto irotin luta gosodit achamun be ijade kana dom losanyiun atipet na yarit raoni adon berngin ne anuke tupakini ikale yao katubetok ido just structures lwe kapugan ngulu lwe doltoni upakinori kwape itungalwa teso anyune be somehow a joke village covid task forces ainakini kapun VHTs ainakini kapuna jene ngisitibe ila pioni bondo ngare bia e ota ay tachamuna pugan ay taraon VHTs luelo marete salary structure la pugan ikarupere o ngare ido e covid lopolo inakoni arere na kwa kinetene osodi e covid someron rai isomeron apupakin kada village committees kada VHTs anyini be duelo nyune toro oblos to somere nyune toro to somero idari a joke so the committees ngure ja relevant ne lona ngisiti be e wodo se golta kanisan waso ai chortuna biai ijase so committee ngol loka village covid task force arai mami nyara tesi ngituto itolo maro committee ngol arai or list angul alwebe itaja auto committee ngol religious leaders ijasi toma cultural leaders ijasi toma so ijepon nelo maro tutoresda toma akiromo akote ngo atiror no ikamtos masks ngesi ijapo gumne polonoi ano mitai sukunyari tade kanyana ipop ido ngun nanenera Dr. Tolu ebe jasa do nyokole gwele ile jente ai do nyu masks au pakino sikeda ngul nara tamaribe okora pugan masks ne jasi tonga birone osodi jo rekon reja sikapun boisna kotori ya gwele ara inye koto ya gwele masti tunga jone masti sigala gwele mask nara adek ijone sikam na dek mamera pugan kam na dek personal responsibility for health osodi bodo a deputy your Charles the koto jai hope that toma yeah a hope a lomuni an vaccination kopokwana mame koto na jaut kelile ichumulwe bakare be district sichielu wateso ya koto anyakare vaccines alemasni konye ajenisida gobe ikidio ko vaccines apa kere Geutu dogero ni keda angul alu etele karita kota domun vaccines luanga ibongul ipolok pet na nesa bakabi tungalu pola jauta de kesi ipolok adumu toni those village covid committees keda VHTs lologa utuberesi ipolok ide poti ipolok ngul ne chumere kato kese gete mami sibo ete odaute keche kato obomosi akiro kecheno ijaz osodi bodo aitachama untu akiro no ekato re bodo aitachama akiro ko amen ngeri no kengon konye bodo ngifomini bodo ngesi kopa de kan ijaz luche konye anyu nibe wana nanyer chari tunga wala ochapa ngina chele opoto ye kato ne mamsiko ta nyaka dole tunga ngeri e kotibori ngino mamun angeta kimdema ai lipi engarenok none ko kere political leaders, religious leaders, cultural leaders emor kiknosberoni e chorati tunga e jok o chawibore no lomasi o tawoni tunga inyeksa tukono kin jatu kono kin ngine jana kin ile tisapa cards o town uma menaptos masks ikopete covid onyonde tunata bongorore ai kore covid ne jasima kech e koti sapangul ajenu nebe e nyone to keso town ne nana boli atara mata tare koneta e nyonyo kwangen bongore tore e losita yari keche tunga Aramne mina skeche tunga ya takisi asomo poni amopango. Osod gudo nyete atesi nini. Epil pana pranare. Konye egitakina parasiano. Achamo tubero ni ebe dai la lolo mami puto skele dai la kolo. Kwa nani ali muntori ejaka eto peitu. Egoro itemuni mwikacha taoni iya makina kwa. Konye koko kwa naite mon batu kuno kino igoro. Ilosio ni ayataki na yarutunga. Aso ngare no kokere mo kisperoni tunga alimuna kusakire joko ide tacha mutu. Asom akiro pone alo ikotora puga. Aloto kato. Ayangalo stade kisi wayo bebale kota kwa na ijulakini. Nukaangun. Ido Voice of Teso, alama atukwa mtunga, alimona inakiro, ichie ichamunete, ichie ingerete, konye nakana awasya, aijar raina kol. Aremamuja kwane pipil, olumuja kirono ina raino. Are pipili ja kwane, elipich, opupok, ocham, au pakinos. Darla suba.
Lamanoi Professor Umaswa anwanga takin oponangon kedeno dautu itunga inakin to manager si it pejo courageous to most studios. But I have seen some important messages here. Andrew Opeitum is asking, can Dr. Tolu comment on issues with the vaccine delivery which may limit people from receiving? And then Aido network here says, I would like to be educated by the doctors here. If a dead body could still be infectious, if so for how long can the virus live inside a corpse? Is it proper for the funeral directors to keep spraying a sealed coffin with the jig? And then Echelo Moses says, thank you for the very informative and educative show. Elipidong be otopaki na ailipana dauna bikakin toma or studio ane making sure that once they present themselves for testing, please test them. Kindly also increase accessibility of the vaccines and medical services to the people back at home. The point of early reporting to the medical facility is very, very useful. And thank you, Dr. Etolu, for the emphasis. Now, our time is also running out. We are getting it fast spent here. I need to take it to the General Director, Health Services, Dr. Olaro, for your last comment and probably what people have given to you on your platform. You respond and give us a way forward.
Yalama, no, dauti tunga alimun. Ako tangare atakin kwa nabe na acho nijao ni kiere nisa ikonai itunga aichume katu. Ivaren vaccines lo jasi is ngarakin protect you adek. So it means so mighty vaccines moon. Normally ebu variant lo itetet. You lakini dope part bonara section mam you lakini virus kere. So vaccines lo jasi eringi so mighty. Pera ngarakina kon kwan ITG adekana. Alimokin jo kwa nabe lotoja obuke musubunu kwa na agia siku even na apukora bole mopira ija situnga osawe because ade pasike sakesa kanyare anu kanyare who are vaccinated of the eligible population. Alimuda na kwa nabe kopokwa na ni rai emillion tedo petebon kila kwa kanyabe esitunga la dumtu a vaccine and not even kwa nabe adumtu vaccines yare Railway pool, most of them are doing a vaccine educated. So, Kopokwana, apart from vaccines in Ejaso districts, Ejasi vaccines, Kopokwana, Aqua, Uganda, not even Mekwana, they were expecting them. They are already here. There are over 5.something million doses of vaccines in the country. But we cannot push all these vaccines into there's already Johnson & Johnson in the country, which is a single dose. There's Madonna which is a double dose. Pfizer is also coming in, and then additional AstraZeneca. There's also Sinopharm, there's also Sinovac. So, and what you need to agenda Kwanabe, all these vaccines work. You should not be saying, because I want the other one, I want it. All these vaccines work. The best vaccine is what you get, and it will be able to protect you. Regarding Kwanabe, if you have got COVID, when do you get the vaccination? I think we have guided that one. You can get vaccination after Ilapiuni. And then, do we test everybody who is coming to the health center? No, we can't test everybody. The tests, the RDTs are only sensitive to Itunga who have got symptoms. If you have fever, a cough, chest, then it can test and will show it. It will be a waste of tests to test people who do not have symptoms. So only those who fulfill the criteria, those are the ones whom we will do it, whom we will test. You do not need an identity card for you to be tested. Only that if there is any other person who can be able to identify you, you can get a test. So, vaccination centers, they don't have identity cards. Lastly, the vaccines, so many vaccines. The vaccines in the regarding this consent form, the vaccination is voluntary. So just like any voluntary, it means like even Lotoja deck is even for Imurokai in job. A Kotoja ikone, I chamun Kwanabe, a Kelina Kinongo, Jiborena Kinongas, so Makino Okere. That's what this consent form means Kwanabe. So that one does not mean Kwanabe. You buikita ijo, ichamujo, alimunokinja jokes ne vaccine, ichamujo, and you can sign Kwanabe, achamuongo. There are some few side effects which come from the vaccines. But even when people talk about clots, you get one clot out of 1 million. But how many people, if you get COVID, about 7 of them or out of 10 will get clots. So we'll get more clots from COVID than you will get clots from what? From the vaccine. Just like any drug else, it will have some side effects. Somebody will react badly. But it will save many more people. So I want to really to call Kwanabe. Let's get people vaccinated. Let's get everybody. Let's get people vaccinated. And I agree with what Professor said that when they come, let them be given the first priority. And we should actually take this chance, and we can be able to push more additional vaccines to Teso, depending on how we absorb the vaccines. So, Eyalamanoi, Voice of Teso.
Indeed, Yalama Sodanoi and Hotel Kosawa Losita kutanga inakine Stephen Opeitum like a minute or two nara kutanga bohu nejai Miss Nora here kede Dr. Tolu and wakiro kechinwa washa. So let me have Stephen. Stephen, your last comment and maybe the way forward.
My last comments will basically and the efforts to bring medical equipment to Soroti. Ige osho, ile piti no inoye support aneja ituna. Our airport equipment low. Let's make sure that it is put to proper use. There is one requirement which we are eventually going to work with Voice of Teso. And equipment will need a total of about $30,000. I get a fundraising working on Atamatonda what we can do here to make sure that the equipment comes to Soroti. Mamika Pnoli Puno Namaka Pnoli Kijoko. Let me look it will be towards a cost. And I am on equipment there. Is someone a Joko Noi around a remebe in Arakinoni and they cannot test okay. Those are my closing remarks.
Thank you from Stephen there. And now in the studio, Ms. Nora, give us your last remarks and what would be your way forward. You've talked and you've given us what government should do, what people should do, and so on. It's a social responsibility. Now, what do we do next?
I am going to speak as a cultural anthropologist. There is a lot of concern about people are putting a lot of emphasis on burials. People are concerned about not burying the right body or they are burying a log. So my point is that it is very important to recognize expertise such as we have done today of Voice of Teso, of the media in communicating these messages out there. I personally think as a cultural anthropologist that the messaging for COVID has not been well handled in terms of presenting it as this is good for you, as we did, for example, HIV and AIDS. Even though stigma for HIV and AIDS is still there, it is not as bad as the stigma now that surrounds COVID, and stigma that is born of the method that we chose for enforcing compliance of SOPs, lockdowns, some of them quite violent. We need to change our style and come back to reasoning with people and treating people as someone you need to communicate a message to. I make a plea that the media fraternity, the humanities, the artists, cultural anthropologists such as I should actually have a equally supported task force to deliver the right messaging, but also to deliver it in a manner that people will understand it. It is different as a doctor telling me something than somebody who comes as my advisor, my friend, and say, "Okwe, nyekbereja yongita limo ribeja ijadek, or limo ijadek ana, you will be treated." And why I say so is that Dr. Etolu here, everybody is saying Ayalama, Ayalama, Ayalama Ngoda, because they have noticed that the most important thing you are doing is your bedside manner. We need to get everybody to be loved like Dr. Etolu, because if Dr. Etolu now tells somebody something, they will appreciate it. Ayalama Noi, Voice of Teso.
Yes, Doctor.
So Ayalama Noi, Tekerno Teso, Ngetakine program, it has been a good one. I've also been enjoying.
That's
especially anyway. So Tekerno Teso, yakero no edai tungala twakate COVID. Ibori soma isongesienta eroka yangara tesigino chalo ekale ebunike desa dekisina polo sote kesa hanyu na tesingin eroko igwekina paper body bag eroko igwekina saduku. So mame yauna chalo mina ijai tungi dislocal le wanyunete atesingin atesina ikope COVID arrival mam nige ona mami jeni nwe dules kwenye kopa ni jenu songe sinata atesini nu mamu rwana po ikope te COVID noi na retwa ni tuwe ibune COVID ngoni kuju akwana na keprobera para akwana ngine joko oja kapoke sile kwe kina saduku mamba atesingin ikope COVID ibori ni ikope COVID ngeso ni libuna tukunu anwedai enatwana itukuno ni ija ene deka ngesi kopido barriebo ngini jaslumamu dekasi
okay
angeta kiningo akotongo esi kweke na teker adeka ne jeke doni anyutube adumutube ne kato la COVID-19 ingara kabere jongol ngiti tungalo lo ikondi jiranin lu yapete kedejo areja ina medumute kato oloto adumune kato teroni pedore tijura riabana otesa ne
Yalamanoi get it up and also dangeta program uponangon, and we want to appreciate those who have contributed towards this program from our various platforms, those who were able to follow us on Zoom. Especially we have the notable people that we invited for this program, Dr. Francis Omaswa, Ejakaita, Dr. Charles Solaro from Ministry of Health, Stephen Opeitum, and together with our dear guests here, Dr. Tolu and Ms. Nora Owaraga, who is a cultural anthropologist, managing director, SIPA Uganda, a non-profit development organization. I can see on Zoom we had a number of people following us, Dr. Biola, Moses Okipi, Simon Peter Laku, Dr. Kware Joseph, Andrew Opeitum, Aliem Soit Mesu Charles, and the others, Richard Patrick Okoed, and to everyone, those who have been on Signal, that is 88.4 Voice of Teso, your choice radio. We want to appreciate the fact that you contributed and you had your time with us in the studio. My name is Charles Akeru. Till we meet then, that is again on Sunday, same time, same station, with another topic of discussion. The program is the TesoGang. Till we meet you on Sunday.
The latest music.